Good evening, everyone. Uh, we are very happy to have everyone here. It's a morning, it's an evening, and we are very happy all of you. A warm welcome to session 7 of the Global Advanced Certification Program on Strategic Research Collaboration and Communication for Emerging Researchers and the International Workshop Series. We proudly organized this workshop by the Global Consortium of Global Health Actors, Leaders, and Thinkers, the Global Health Forum, the Global Brain and Mental Health Forum, in collaboration with local delivering partners with Bangladesh Institute of Innovative Health Research. Today marks the 7th session of our international workshop and the panel discussion series, which is already featured by eminent speakers from all around the world each weekend so far. We have had a few permanent and renowned speakers from top academic institutions in Africa, Australia, India, Malaysia, Singapore, and the US. We are deeply honored to host two engaging panel discussions today evening, featuring esteemed professionals who are transforming the face of public health, innovation, and implementation. These sessions will be shed light on the evolving global health paradigms of lifestyle medicine and community-centered healthcare. We are once again joined by Professor Maheswar Satpathy, the CEO of Global Alt and the Director of COE-CCPH India, who will be moderating both the panels. Global Health Consortium of Global Health Leaders and Thinkers operates under the Global Health Leadership by Global South Initiative, a flagship project of the Global Health Forum. The consortium brings together global health experts, researchers, practitioners, and policymakers, especially from developing and underrepresented regions, to collaborate on transformative research that drives equity and systemic change in health. As of today, the Global Consortium is the largest dedicated professional consortium of global health, with more than 1,800 leaders from 170 plus countries who have applied to be members with a rigorous process of member selection. Our visioning is to reimagining global health leadership by the Global South, decolonizing global health. We are the global alternative. Bangladesh Institute of Innovative Health Research is a non-profit student-led research organization that promotes research culture among students and early career researchers. Nearly 40 students contribute as research assistants and over 10 serve in core managerial roles. BIIHR actively conducts public health research and regularly organizes training, workshops, and seminars to build capacity among emerging scholars. We have a few rules for today. Please remain muted during the session unless you are invited to speak. Use the chat box actively to ask any question or share your reflections. Attendance will be tracked from start to end. So please be present. Don't come at the last moment. Maintain a respectful and inclusive environment throughout the meeting. Chat box will be monitored regularly. Any unnecessary, repetitive, disrespectful, unprofessional, and hateful comment in the chat box or question answer targeted towards anyone will be deleted and such members will be removed. To introduce our panelists, number one, we have Dr. Samuel George Hanstack, and the title is Lifestyle Medicine, Emerging Pillar of Global Health for Advancing Personalized Health, Wellness, and Care. We are very honored to welcome Dr. Samuel George Hanstack, Professor and Head of Medicine, Christian Medical College, Vellore, and Founding President of Indian Society of Lifestyle Medicine. Moderated by Professor Maheswar Satpathy, CEO of Global Alt and Professor, Global and Brain and Mental Health and Public Policy, India. Professor Satpathy, may I invite you to introduce Dr. Hanstack and initiate the discussion?
Okay, one question is missing, so you are not aware of it. So Faisal will do my introduction first, and after that I will introduce Professor Hanstack. Yeah. Faisal, over to you.
Let me introduce our esteemed moderator, Professor Maheswar Satpathy sir today. Professor Maheswar Satpathy is a world-renowned leader in One Health, global health, planetary health, brain and mental health. He is a much sought after expert in epidemiology, health emergencies and implementation science and health innovation using the power of emerging and futuristic technologies such as AI, ML, LLM, and generative AI, and geospatial information systems, science and technologies, geographical information systems, GIS, and remote sensing. He builds on his core areas of expertise in cognitive and computational neuroscience, psychology, and global health to benefit humanity. His sustained engagement with UN Sustainable Development Goals and ethics in the broader area of public policy has led to holistic societal transformations in various LMICs. Professor Satpathy has a humble H index of 78 and cumulative citations over 154,000 plus. He has published extensively 285 plus peer-reviewed scientific articles and book chapters in journals of global repute, notably in Nature, Science, The Lancet, NEJM, JAMA, PMJ, and others, and has offered keynotes and invited talks at more than 200 top international conferences and global congresses in the past 20 years. He has an impressive all-metric score of 68,255, exemplifying the large-scale social impact driven by their work. He is a passionate catalyzing and co-creating sustainable impact in society with a deeply immersive process of knowledge incubation, mobilization, translation of science into actionable practices, evidence synthesis, and evidence-based decision making, traversing the journey from evidence to policy with robust experience at various public and private institutions or organizations and influential roles on advisory boards of INGOs, think tanks globally. His focus is cultivating servant leadership and propelling cutting-edge research and practice. This journey has emerged by strategic initiatives that have been fostered educational excellence and societal impact through multifaceted engagements with global health and development policy. He has a successful track record of over 20 years in designing, delivering, and evaluating global and national public health programs in multifaceted engagements in Asia Pacific, Africa, and Europe, and clinical practice in India have contributed to my well-grounded perspective and expertise. His strong diplomatic skills and a proven track record in developing strategic partnerships have helped from vital global collaborations, enriching public health and mental health policies and initiatives. His multidisciplinary approach, integrating development policy with global health, has empowered teams to translate complex research into societal impact to LMICs. Now, I would request Professor Maheswar Satpathy to introduce our esteemed guest today, Dr. Samuel George Hasek, and start the discussions. Thank you.
Thank you, Professor, for such a generous introduction. Okay, I hope I'm audible and visible very all right. Please give me a thumbs up if it's all right, and then let me start. Okay, all good? Okay, great. So this is my immense pleasure as well as most privilege to introduce our guest of honor today, Dr. Samuel George Hasek, MD, MA, FAIM, MAR, Diploma, BLM, Professor and Head, Department of Medicine, Christian Medical College, Vellore, Founding President, Indian Society of Lifestyle Medicine, former President, Asian Society of Lifestyle Medicine, and former Deputy Registrar, CMC, Vellore. Dr. Samuel George Hasek is a distinguished physician, educator, and pioneer in lifestyle medicine in India. A graduate of the All India Institute of Medical Sciences, AIIMS, New Delhi, MBBS 1984 to 1989, and MD in Medicine 1991 to 1993. He has held key clinical and academic roles across South Asia, including a 6-year tenure at BP Koirala Institute of Health Sciences, BPKIHS, Nepal, in between 1994 to 2000, and subspecialty training in gastroenterology at CMC Vellore between 2000 to 2002, where he continues to serve. In 2012, Dr. Hasek completed a senior fellowship in lifestyle medicine in the USA, training at leading institutions such as Loma Linda University and lifestyle centers at like Weimar, Wildwood, and Uchi Pines. He subsequently founded the Wellness Clinic at CMC Vellore in 2013, which continues to offer integrative care through inpatient consultations, lifestyle interventions, and community health camps. Dr. Hansdorf played a foundational role in establishing the Asian Society of Lifestyle Medicine in 2017 and the Indian Society of Lifestyle Medicines in 2018, serving as their inaugural president. His passion for education is reflected in his leadership of multiple programs at CMC Vellore, including MBBS lectures, intern orientation, and the 8-week lifestyle medicine training program for postgraduates and interns. He also spearheaded the launch of the postgraduate diploma in lifestyle medicine (PGDLM) at CMCV in 2023. He is a committed and academic as well as mentor. He is actively engaged in supervising research across undergrad, postgrad, faculty, and PhD levels. His research initiatives include the 2024 National Health Conference and the launch of the book Lifestyle as Medicine, with a forthcoming Norris Cookbook in 2025. This is the wide diversity of the profile and the rich erudite, intellectual acumen of our professor and keynote speaker today, Dr. Samuel George Hunstag, and I have the immense privilege and pleasure to invite him to speak to all of us. I'm very, very confident that our participants and the attendees who are listening to me and who are going to listen to him are going to be greatly benefited by his wisdom and his vast experience that he is going to share with all of you. So thank you, Professor Samuel George Hansdorf. The stage is all yours. Thank you. I look forward to listening to all your great ideas. Thank you.
Thank you so much, Professor Satpathy Maheswar. And I just want to know if my PowerPoint is visible.
Yes, it's visible, but
Okay.
could you please
Okay.
put it on a display? Yeah, now perfect.
So is
Thank
it fine? Okay. So as mentioned, just want to have a good evening, good morning, good afternoon. Not sure from which continents all the participants have joined, but I just want to bring a warm greeting from the Christian Medical College, Vellore, where I have been working since last 2000, almost a quarter of a century, and it's wonderful to be able to connect to all of you. I got in touch through Philemon and to get to know Professor Maheshwari. Now, the topic of lifestyle medicine, I thought I'll just spend some time just to help understand the whole perspective of lifestyle medicine. We have heard about this term, we know it, we understand it from the public health perspective, especially at an era where non-communicable disease is at a rise. We are really concerned as a health professionals how to address these non-communicable or chronic diseases, and what does role of lifestyle medicine comes. uh, I would like to share something more than what we already know, and we will spend the next few minutes talking about it. uh, just a few of the outline. What I would be trying to cover is how do we define lifestyle medicine, what are the various domains and pillars of lifestyle medicines, what is really the challenge in our understanding about non-communicable disease and its management. I'm told that many of you are from a public health background, and one of the key areas that everyone is looking at is how do we do research and understand diseases, approaches, managements, and finally bring it to policy levels. And also looking at the evolution of medicine from 1, 2, 3, and 4. So, if you really look at the epidemiology, one of the four major causes for non communicable disease are cardiovascular disease, cancer, respiratory, and diabetes. These constitute almost 80% of all the non communicable deaths. And the cause for these are, as you can see below, are diet, exercise, tobacco, and alcohol use. Now, when I place this on your left side, on the right side, you see a very recent activity that happened was the COVID. We all are gone through that, and it's very fresh. From 2020 to 2022, in 3 years, we had a lot of mortalities and morbidities because of COVID. I will just come to that and touch comparing these two entities. Really speaking, we can recall the lockdowns, uh, people watching bored, wondering what to do from your terraces. The stars did look much more starry and clearer. The roads was amazingly quiet and barren, and these are pictures which is still very vivid in our minds. Uh, I'm comparing that with number of our fast food areas that we love to be and go over there. Now, I was surprised to come across this. This is from Egypt, which has been freshly brought to Dubai, and it's called Heart Attack. And uh, as much as they may be joking about it, but really speaking, this is something very serious. And let's see the numbers. The total number of deaths for COVID, if you can see till now, is about 7 million deaths, and compare that with death because of cardiovascular disease per year. In about 3 years, COVID killed 7 million people, and cardiovascular deaths are 17 million every year. And for the COVID, you had a full lockdown, but none of our fast foods or anything has been locked down for the disease that causes almost 3 times more number of deaths every year. The transition from 1990, our TVs were fat. Now people have become fat. So, where most of our money goes into the tertiary care and the least on the public health promotions, you really need a flip on that pyramid. And this is the fact, this is the reality. We are working in a clinical setup, and I had 2 days call yesterday. It was two regular call, almost 50 patients was admitted. I didn't sleep the night. And that takes the toll when we busily take care of the sick patients, and you have to pitch in everything to do. But the question is there any way that these numbers of patients that comes to a hospital can be reduced and be done? That is something that we need to understand. uh, is are we able to hear? Just wanted to check. Yeah. So let's visit the very foundational definition of health. That's as we started. This is the year 1948 when the World Health Organizations put in definitions of health, not just merely an absence of disease, but a state of complete physical, mental, and social well-being. We have to ask ourselves today, is that the standard goal that we have for every patient that comes to us? We at the best may be able to take care of the physical needs, but how do we manage to give that health as defined by WHO in our everyday care of the patients? So I'll be talking about four paradigms shifts as I understand over a period of time that I have practiced as a clinical physician. One, from medical to health. Second, from organ to whole person. Third, from symptom to the root cause. And fourth is disease to well being. Now, if you look at paradigm one, this is where I did my studies, which is called All India Institute of Medical Sciences. And very interestingly, in 94, as Professor Maheswar mentioned, I was working in Nepal for about 6 years. And this institution is called BP Koirala Institute of Health Sciences. If you try to catalog and look across all the names of all the colleges, you'll find it's all medical colleges. This was the first time we came across a college which was called by name Health Sciences. The shift from medical to health makes a significant difference in the way we think and the way we care. This is very significant as we talk about. When I came to Christian medical colleges in 2000, I was very intrigued to hear the name. Instead of pediatrics, they call the department child health. Instead of psychiatry, they call it as mental health. And instead of the preventive and social medicine, they call it as community health. The word health, as much as it's a term, it puts within yourself a commitment that unless you have taken care of the whole person of the whole person care, you have not really provided health. You have just about provided a medical care, you have given them some medicines, but if you truly want to provide health, health is holistic. And that completely changes the paradigm at which you look at it. Paradigm shift number two, as we saw the definition of WHO, from the physical, mental, social, you can take it to many other paradigms like environmental, occupational, financial, spiritual, and emotional. So you are moving from an organ to a whole person's. We have cardiologists who are specializing in heart. Even in the heart, we have people who specialize in the arteries, into only the rhythm disturbances, and the specializations keeps going into those minor organs or organelles of the body. But we have a book called Pathology by Robbins, very interesting statement. The Dr. Robbins says that we should not come so close to the tree that we lose sight of the forest. So, as much as when we go down into the details of understanding disease and causations, we still have to have a vision that has a holistic perspective. Without losing sight of that, we should not technically be making decisions at that small level and forget the larger level that we have. Finally, the American College of Lifestyle Medicine, as they put in these 6 pillars, to say that if we have to take care of a sick patients, we need to take care of it holistically, which includes I need to talk about the diet, about physical activity, identify the patient is stressed. We need to address that, social, sleep, and substance abuses. This was put by the American College of Lifestyle Medicine. Of course, they were more interested in lifestyle medicine, but what it did was it impacted the mainline society of our health medical group, and this is the American Heart Association, who was able to adopt that perspective in 2010 by coming up with something called Life Simple 7. Now, of course, these are academic and these are um, evidence-based groups, and so anything that you say has to be proven research-wise, and so all the things that was proven by various studies done was put together in Life Simple 7. And in 2022, they added on one more component called sleep in that list. And because there was a lot of evidence to say how sleep itself can affect our disease, our morbidity, and mortality. So it's really encouraging to see how the mainline medical science groups are looking at lifestyle and lifestyle principles and pillars to be primarily incorporated in the care of our patients as they come to our health setups. So essentially, we are going a little backwards. If you look at the Chinese concept of health, the yin and the yang, if you look at the Ayurvedic concepts of health, the various humus, pitta, kapha, and when you look at the Greek, they talk about phlegm. It's basically the equilibrium between different domains that gives us health. If the equilibrium gives us health, then what causes disease will come to that. So here we are talking about the balance. That's the second paradigm. The third paradigm is from symptom to root cause. Now, if I have to tell you, um, if a patient's come with malaria, how would you treat? The patient has fever. So what should I give? Paracetamol brings down fever. You would tell me, but then you have to treat malaria. It's only when you treat malaria, the fever will go away. And that makes sense. So, whenever we treat malaria, who comes with fever, I give them the treatment for malaria. And when the malarial parasites are killed, the fever also goes away. Now we come to the chronic diseases. How do you treat? Now, if I were to tell you, no, I want to treat malaria with paracetamol. I give him paracetamol, the fever comes down. The patient came with fever, I give them paracetamol, and the fever is gone away. What is the problem? You will say the fever will come back. After 4 hours, the effect of the medicine goes away. I said, give him another paracetamol after 4 hours. You say, but then it'll come back again. So I said, every 4 hours you give him paracetamol. You ask me how long? I said, for lifetime. And you look at me and you say, you don't treat malaria with paracetamol every 4 hourly for lifetime. But I ask you, how do you treat diabetes? You give them a medicine which works for 12 hours or 24 hours, and you give it for lifetime. How do you treat diabetes? How do you treat hypertension? How do you treat heart disease? How do you treat arthritis? Virtually every disease, we are treating the symptom for lifetime. Is there any other solutions to that? And so the third paradigm is to move and find out what is the root cause, because if you treat the root cause, the symptom will go away. And I will be talking about lifestyle from that perspective. The fourth paradigm that we talk about is, most of the time, for non-communicable disease, we have said that we can treat it. If somebody asked me, can you cure diabetes? Can you cure hypertension? I would tell them, no, 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 you cannot cure, but we can definitely treat. We have good medicines. You give them, the BP comes down, and the patient will be okay, and all the complications of diabetes, hypertension, we can prevent. But curing is not possible. So, as medicine people, that's how we've been trained and that's how we have practiced medicine. But sometimes it's our surgical colleague who had to come and teach us how to treat medicine. And our surgical colleagues came up with something called bariatric surgery. When you do a bariatric surgery for patients who are obese and not able to lose weight, they, after the surgery, they actually lose weight significantly. And the moment they lose weight, their sugars, their pressures, everything comes down to normal without medicines. And so they said, oh, we have cured diabetes just with a surgery. And they actually use the word remission of diabetes through bariatric surgery. And for medicine or treatment, we have always tried to talk about lifestyle medicine, where people said, oh, who will follow lifestyle? It's so difficult to eat that kind of food. I love food. I can't stop eating food. And so compliance to changing of diet is difficult. But when you do this bariatric surgery, for the first time, physiologically, it was proven that you can actually reverse disease or remit disease. So the word remission or reversal was first time brought out by the surgeons when they did this bariatric surgery in obese patients. And now when you look at it, you look at the statistics, 1995, the first time when they did the bariatric surgery, the remission of diabetes was in 83%. 2004, through these Swedish obese subjects, the remission was in 72%. In 2012, the latest one, Stampede trial shows about 75, 62 to 51% reduction in remission of diabetes over the 2 years, 6 years, and 12 years period. Now, when you look at the same side on lifestyle medicines, when you try to ask them to change their diet, to do exercise, try to reduce weight, the the remissions was doesn't look very impressive, 11.5 in look ahead trial, 46% in the direct trial. And if you look at 2022, it was about 70%, but this was a very small group of patients, 20 of them, lot of intensity and follow-up was there. So because of that, you achieved almost 70%. But basically what it is saying is that the proof of a concept is that if you actually follow diet and exercise, you can actually bring down or you can remit the disease by treating the root cause. That's basically what we have been trying to say over here. And then finally, American Diabetic Association finally in 2020 reluctantly accepted that the remission concept in the chronic disease is possible, and they have gone ahead and given certain classifications, criterias of remissions, whether it's partial, complete, or modified. So slowly, the mainline medical societies are accepting that if you actually focused on an intensive way of incorporating lifestyle among the patient's care, you can actually achieve remissions among them. One of the historic study that was done by Dr. Dean Ornish, is a cardiologist from California. And as a cardiologist, so many patients with heart attacks comes and you keep putting in a stent in them. And at the same time, somewhere he got impressed that we need to incorporate lifestyle in them. And being a cardiologist, he did a randomized controlled trial. This was 1990. This is published in Lancet. And what they found, and then he did a 5-year follow-up in 1998, and this was published in JAMA. And what they found was when you actually do um, lifestyle intervention, this was before certain drugs had become standard. Without drugs, only with lifestyle, he was able to show that all these blocked vessels could actually be opened. Once upon a time, we thought atherosclerosis was a non reversible process. But his study showed that even a disease which we thought was non reversible was reversible just through sheer lifestyle changes. If we look at the, I'm not going to go through each one of them, but just to give a perspective, right from 1938, the first one was Harvard study of adult development. There have been a number of major cohort studies. One of the studies that we all are familiar with is the Framingham Heart Study. That's in 1948, the same year when the World Heart organizations talked about the definition of health. And following that, some of the leading centers have been doing major cohort studies: Baltimore, Whitehall, Adventist Health Study, Nurses Health Study, the Physician Health Study, both in Harvard. Blue zone studies, some of you would have heard of, and calorie studies. All these are major cohort studies, and you know how cumbersome it is to have a cohort and follow them up and keep observing what they are doing and look at the outcomes. And all these things put together showed that people who followed a healthy lifestyle, number one, we were able to prevent diseases. Number two, that those who had diseases, they were able to be reversed if they were able to follow. And so that is something that has come up very strongly. So, coming back to the same statement and the definitions, that really speaking, the way we should be dealing with our patients should not be in a reductionist way of giving a medicines, giving a paracetamol to malaria, but trying to look at it holistically and trying to look at the root cause, because without that, you would not be able to achieve remission or reversal of a disease. I am sure some of you would be familiar with the Framingham Heart Study. The first time we got to know why people had heart disease, because the risk factors of heart disease was not well known. And in Boston, they took up a group of people and they followed them up for many years, try to seeing which are the parameters which caused heart disease, and high blood pressure, sugar, lipids, smoking, all those things was found out through these studies. And interestingly, they continue to follow up the patients and the patient's children and the children's children. Almost 3 generations has been followed to look into different diseases. And it's interesting the amount of wisdom and the medical knowledge we have come through that way. Um, as mentioned, the risk factors for heart disease were diabetes, lipids, hypertension, smoking, obesity, sedentary, and stress, through the Framingham study. In 1970, we had the Adventist Health Study, very closely following the Framingham Heart Study. And they again looked into different parameters which contributed to longevity, contributed to mortality. And what they found was everything was falling into these headings. As on the physical, it was the diet, the exercise. On the mental, it was the stress. I'll talk about the social and other groups. And most in the diet, what was showing to be more helpful was a plant-based diet. We use the term called whole food, plant-based. Whole food means do not refine it, do not process it. Plant-based means most of the time, if you are feeding on a plant-based diet, fruits, vegetables, cereals, and pulses, you are healthy. If you have to take any animal-based diet, should be taken with restraint in the amount, and be careful, the amount should be kept within particular levels. Harvard Medical School came up with these 3 major cohorts among the Nurses Health Study 1, 2, and 3 in 76, 89, and 2010. And all of them came up to the same findings about the diet. A lot of it has come on the diet, We have got to know that fiber should be high. We should cut down on the trans fatty acid and red meats. We talked about obesity. We talked about physical activity, alcohol and hormone therapies, or many things. I'm not going to the details, but just giving a snapshot. Now, when we look into the diet, when we look into the exercise, there's another area that comes as environment, and what has environment to do with longevity, and number of studies are coming up on that, about how air pollutants, how water pollutions, how noise pollutions, food additives, alcohol and tobacco, we already know. Climate is a big area which is being studied, and technology overuse, screens. We had one of our professors from NIMHANS, Bangalore, who's been talking about how the use of screens has been affecting both the mental and also the physical health of many of the people. In the social areas, just wanted to speak now. 1938 is actually one of the first cohort by the Harvard University, by Dr. Robert Waldinger, who talked about what is the association of social health and longevity. And this was in 1938. Subsequently, in 1965 and in 2010, they did a meta-analysis to look at how does social connections affect our health. And this was quite a pioneering study. In 1938, there are two cohorts from Harvard sophomores and from the inner city Boston men. And these were followed up for almost 85 years. They also included the spouses, children, and the newer generations. And they had almost 1,300 descendants followed up. What was the result? The result was strong relationship are the key to happiness. Very interestingly, when you look at longevity and if you ask a question, what is one single most important predictor of longevity? Interestingly, it's not diet, it's not exercise or sleep, it is social connectedness. If you have a strong social connectedness, your longevity is the most, social connectedness is the strongest predictor for longevity. Quality relationship, strongest predictor for happiness and health. Loneliness, imagine, is as harmful as smoking or obesity. Loneliness. Today, most of us want to stay in our room. We are happy with our gadgets and social media. We are so reluctant to go out, talk to people, sit down and do. But this is very interesting to see that loneliness is as harmful as smoking or obesity. Money and fame don't guarantee happiness. Most of us, we study very hard, get into a good institutions, get a good job, earn a good money, rise up in our professional careers, and we think that is going to give us happiness or longevity. Beyond basic financial stability, wealth does not significantly increase life satisfaction. This is what the study showed. Fame and career success don't necessarily lead to long term well being. That was the second thing they came across. Third, physical health and emotional well being are linked. Healthy relationship reduce stress, which protects against heart disease and dementia. Positive mental health, being optimistic, having a sense of gratitude and resilience leads to longer life expectancies. Fourth, lifelong learning and purpose matters. Having a sense of purpose keeps people engaged and motivated. Continuous learning, curiosity, and adaptability contribute to emotional well being. Fifth, social fitness is as important as physical fitness. Just like exercise keeps the body healthy, nurturing relationships keeps the mind strong. Making time for friends and loved ones is a powerful investment in long term health. Very humbling, because sometimes we have relationship where I get something out of you, I meet, talk very quick and move away. But we are going back to understand that unless relationships are meaningful, deep, beyond self interest, it is going to adversely affect your health. So, social factors, social relationship, we are talking about emotional quotient, social support, and social engagement are very important factors. This, as I mentioned, they've also got some weightage that loneliness is almost equal to 15 cigarettes a day. So we have to think about it. I just mentioned money and fame doesn't give us health and happiness. And stress, very interesting study. This is by Dr. Elizabeth, who also got the Nobel Prize in health. And her study was on telomeres. And what she found is people who have high stress, the telomere length reduces. And telomere length is related to our longevity. And it shows how stress can affect our body, our physiology, and many diseases. So, and then finally, we are talking about meaning and purpose. I am not sure whether you have heard of blue zones. We have the one National Geographic journal by name of Dan Buettner. He suddenly thought of something. I want to go to places where people live the longest. So he said, I want to go to places where people live more than 100 years and then find out what is the cause for their long life. And he founded these few areas in Japan, Okinawa and Sardinia, Italy, and in Greece, Icaria. Interestingly, North America, Loma Linda, and South America, Nicoya. So in these places, when he went, and he went with his team, and his team was a people with biostatistics, epidemiologists, scientists who wanted to study it scientifically and not just making some interviews like a newsletter and make it and the things. It was a very scientifically planned study, and when they looked into all these things and tried to find out what is the cause for longevity, they were able to find out it's the same factors from diet to exercise to stress. Very importantly, it was a social connectedness. They would meet people, greet, sit, talk over a period of time, and the faith. Many of them had their own faith, and that seems to contribute. This is Loma Linda, where the people stay there. They have a very strict dietary pattern. They take physical activities, and very interestingly, they rest on one day of the week. They call it as Sabbath on Saturday. And here they found people are living more than 100 years. So, really speaking, health is combinations of all the various paradigms that we talked about. And if that is what gives us health, disease is when there is a disequilibrium between any of these factors. Sometimes it could be in the physical, others it could be mental or social, spiritual, environmental. If you have a disequilibrium in any one of them, since all of them are connected, it affects each other, leading into a disease. And if that is disease, and this is a disease model, where the contribution of gene is less than 10 to 15% for a disease. You may have a gene, but the gene has to express. And the gene expression is determined by lifestyle. Very interesting. We are doing a lot of studies on epigenes. Epigenes are genes that determines the expression of the disease gene, and that is affected by lifestyle. There are only few diseases that, irrespective, it will express in less than 10 to 15%. Most of the time, even the genetic expression is under the control of lifestyle. So, lifestyle plays a major role. Environmental also has a role to play. And this is what contributes to disease. And so, if there is a disease, healing is about restoring back that disequilibrium, restoring back that balance. So, in this whole model of health, with the disease being a disequilibrium, the process of healing should be restoring that disequilibrium. And if we start seeing disease from that perspective, then our entire approach to taking care of a patient has to be completely different. At this point of time, we are medical sciences. We wish we would move towards health sciences. So healing is complex. Healing is complex. So you would realize it's not easy to start talking about stress, social, and other issues. There are a lot of self factors that has to be addressed. Environment, physical, and social are also needs to be addressed. And to do all these things, the key thing or the key resource we need is a time. And that is what we struggle with. And what we have not talked about is a transcendence factor. So, from physical, mental, social, what about spiritual? Does that also have a role to play? Um, we have talked about behavioral change, trans-theoretical model. If you really want people to change, you literally have to go through these various steps just to show you that that's what it takes to bring about behavioral change, not just sitting in 5 minutes. If I give him what they should do, doesn't really translate into change. If you look at the relapse rate with education alone, if I was just to tell them smoking is bad, you stop smoking, how many people will stop? If you look at the statistics, healthy eating relapses 70%. Exercise, after 1 year, only 50% are doing exercise. Smoking relapses 90%. Weight loss, almost 80% gets back to their weight if you only inform them or educated them. So you realize that changing behavior is not easy in policies, in government. The major focus is on educations, but this is the best that education can achieve. So that means we need something more than that, and that means the only way you can decrease relapse rate is by self-monitoring, by peer support, by coaching principles, cognitive behavioral therapy, smart goal setting, and some form of incentives. There are multiple things that has been put into place if you really want that person to change and the disease to be into transcendence, to help people have a meaning and purpose in life, to experience inner peace and well-being, to feel being collected, to have values and morality. This also requires a different kind of an approach in these patients, because unless you address the core of a person and the spirituality of a person, very less likely they would make a change. How do we bring all these things together in our patient care? That's a question that we have to ask ourselves. What has been our journey in CMC? Many things Professor Maheswar has already said. We started somewhere in 2012. It's been a long time, but you realize, you may wonder, by this time we should be doing fantastic things. But you see, most of our time get caught up in taking care of the physical things or the patients, because that's how busy our setups are. And in a very traditional way, most of our time goes into taking care of just the medical science part of it. So even for us to build this up has taken a long time, but a few things has happened. 2017 and 18, we were able to get the Asian and Indian Society. We were fortunate to start a course, which is almost the first one in this country, to train people in addressing patients in a holistic way. We are able to get a book, and this book is addressed to common people, so that if they read, they would know what lifestyle medicine actually means. And since many of the cookbooks are quite Western, may not be Indian contextualized, we had a burden to take out a cookbook on healthy eating, which is very contextualized to our Indian setup, and that is called Nourish. We are trying to get it through a publisher into the people. So that is where we are, and it is wonderful to get connected to so many of you who are so passionate about public health and research. I have just tried to cover up an overall concept on these things. There are, as mentioned, we are doing some studies, some ICMR grant studies we are doing in different areas, and we would be happy to talk and discuss in a Q&A session. So I will stop here, and I want to wish each one of you a very healthy and a happy life. Thank you so much.
Okay, thank you. What a wonderful presentation, Dr. Samuel Sanjak. I think we'll quickly go into our panel discussion now, and we'll take the questions at the end. That's the format, because if we allow the questions now, it will all detract the entire discussion process. And I'm sure questions are increasing. So participants, please feel free to keep putting questions in the Q&A section. Okay, we'll read some of them. Hopefully at the end we'll have some time to read them. Okay, we are delayed by a few minutes, so I'll try to do the full justice. Dr. Samuel, whenever you're ready, let me know and we'll start. You're good to go, are we? Okay, right. Brilliant presentation. wonderful interventions and a lot of perspectives that we people in the field of psychology literally have pioneered, and we have been advocating for almost 100 years now, and people are not listening, people are not paying attention. And very recently the field of medicine, medical sciences have started paying attention, which is a little unfortunate, but we are happy. Sooner than later, it's actually happening. So let me go quickly to the questions that I have ready for you. Question number 1. What exactly is lifestyle medicine and how is it distinct from traditional Western biomedicine and clinical approaches? And how are you making experiments or innovations around that in India at CNC1?
Okay. Uh, uh, Let me put it this way. Number one is we want to see lifestyle medicine as an evidence-based medicine, because in the name of lifestyle you would see so many people with big claims and uh, uh, centers going on. So we have very consciously and intentionally put in, and we are a part of the global initiative started from American College of Lifestyle Medicine. Right in the beginning we have very clearly said that anything that is evidence based is what we will talk about, and if we do not have an evidence, we need to build up an evidence before we talk about it. So lifestyle is an evidence based, incorporating various domains of health, as we just talked about, in a patient care or in a medical care. So, this is not just preventing disease, which is usually the area of community medicine, but now it is becoming a clinical science where, when a person has already developed a disease, by using lifestyle principles, we are able to control the disease and, if possible, get them in remissions and stop the medicines. So that is how I would define lifestyle medicine. And what we are doing is there are three things that we do in any medical setup. Is one is service, as patient comes, you provide them care. Second is education. And so as a part of an educations, we have started this course. We have within our unit, we train our interns, our postgraduates in the principles and practice of lifestyle medicine. And we are also doing a number of postgraduate theses and faculty collaborative researches is what we are doing to add on to the body of science of lifestyle medicine.
Excellent. Such a well-rounded, very comprehensive answer. So I'm very impressed. In fact, let me go to the next question. What potential role can lifestyle interventions play in preventing and managing non-communicable diseases? I know you have talked about it, but I want you to elaborate a little bit about it. Preventing and managing non-communicable diseases in low resource settings in particular.
So we are looking at the audience whom to reach out. One of the audience which is of our interest is when children are young, and if it is that age that we intervene and equip them and empower them to say that if you develop a habit of living a healthy life, most likely when they become an adult, it would have become a part of their habit and they will do it. And if they do that, the incidence and the prevalence of these diseases will come down. So we have started, we have actually kind of prepared a textbook on health from grade 1 to grade 10. We are just in the process of implementing in the schools, and we want to very carefully monitor from the baseline and study the impact of the school curriculum in the students. We are trying to reach out to the teachers who will be teaching the students, and through the students we are hoping to reach out to the parents who technically will have to take the responsibility, because the food, cooking, making them sleep, making them wake up, the use of screens and all those things has to happen. So the whole curriculum is so designed that it will address these three groups of people: the teachers, the students, and the parents. We are also working out an app uh, to track all that they are doing. And then we want to look at one of the key things that we are looking at is how does lifestyle affect the cognitive function of a student, because that's one thing the school is interested, the teachers are interested, and the parents are interested. They just want to see that kids having 90% and get into some big institutions. They're not really bothered about how holistic development they are. So we want to negotiate with whatever you are interested in. So we are bringing the cognitive functions, and as a part of the study, we are planning to do the baseline cognitive functions, and with this holistic interventions, we want to see how does that cognitive function change over a period of time. So that is one group that we are looking at it. The patient who comes, we have a clinic and we are have a follow up for them. We are also thinking of a workplace wellness where most of the time, most of the adults spends in the whole day is in the workplace. If we can have a wellness program in these places, we are very much convinced that that will really affect and improve their lifestyle and improve their NCDs, which is there. So the schools, the colleges, the workplaces, and from the hospital. And we currently we are working on an ICMR project where we are planning to train the health workers on the ground in lifestyle education, so that when they go home to home, they will be talking about lifestyle. And most important area of intervention is behavioral change, that we train them how to get connected with these people at home, talk to them, find out who they are, where they are, what the life challenges are there, and slowly make a journey of helping them to look at life, to health in a different perspective, and be a kind of a wellness coach on the ground. So those are some of the areas that we are currently working on.
Okay, great, excellent. My question is again is going to give you a little bit more opportunity to expand on your work. How is India and South Asia adapting to lifestyle medicine as an approach, and are we able to sufficiently integrate into the mainstream health systems? What's your experience in this regard?
Yeah, it's a big question. So when we had a book release in 2024, uh, Dr. VK Paul was there from Niti Aayog, and he was very impressed to see that the book has been written by some of the eminent people of the country for the common people. He said everything is fine. You tell me as a Niti Aayog, what should I do to translate it on the ground? I said, very good questions. I don't have answers. So I think it's a evolving process. And as I mentioned, that government of India already has a few programs like Eat Right, Move, so physical activities on the diet. All these things are kind of there, but how much that is translating is a question. We are looking at opportunities to partner, because we shouldn't be looking at somebody who's coming up with a different solutions. The solution is already there, we all know it, but how to translate, it's more of a translational activity or a translational research that will help us to understand. So I think we are in the process of understanding that. In the community, we have done few um, qualitative studies among the health workers and among the community people to find out who they are, what do they understand about it, what do they think will work, what is the thing that they will make changes. So putting those informations together, we are packaging it as a program, so that based on that understanding, we will work among them. The school will go through that same steps. Before we give them a packaged program, we actually want to understand who they are and what they have in their minds, and what is it that if we brought in will make them change, is a something. So I think on all these three areas, we are in the process. I wouldn't be able to tell you that we know it and what the solution is, but that's what our excitement is. I want to mention one more thing over here, is that we are also working on technology. And I guess I did hear about your CV, about your interest. And so we do have a startup in Bangalore who is helping out on the AI. So we are trying to work out app system, and we are also trying to automatize many of the health parameters that we want to manage. So instead of them trying to enter those values, which sometimes are very cumbersome, so most likely they will not. So if it is diet, we just want to take a picture and send it. And we want to train our AI to say, just with a click, how close and exact nutritive values can you give it to us, is something that we are looking at, because diet is the most complex part of capturing that. physical exercise, there are enough apps and all. Stress, social connectedness, sleep would be easy. So we are looking at all these things integrated together, so that when you have all these things coming on a dashboard, it gives me a complete picture about different domains of that person. And using that, we prioritize what seems to be the major pressing issues, begin a journey with that person, addressing each issue one by one, till we are able to bring them to that equilibrium among all those parameters. And if we achieve health, then disease automatically would be reversed.
I agree. Yes. So, associated with all that we have been discussing, is another pertinent question that I want to ask you. Can lifestyle medicine improve health equity? And how can we ensure it reaches the marginalized and socially disenfranchised population? Because many times when we talk or think about lifestyle medicine, the images of gym going population, urban population, those who are able to afford yoga, meditation, and many other, like very good diet, keto diet, this diet, that sort of diet comes to our imaginations. So how do we change this image, and how do we actually make it available and equitable for everyone?
Thank you for asking that question. One of our last medicine annual conference was on equity, and so we had different speakers who were quite uh, I, I mean, we never really saw sometimes very strongly from the equity point of view. And when we were talking to some of our hospitals where we are planning to do these studies, and we said lifestyle and diabetes, they said, no, 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 I don't think so, our fellows can do lifestyle. I said, why? They barely get 1 or 2 meals to eat. So what lifestyle you're going to tell? And then you want to ask them eat broccoli or some salads and other things. I mean, I don't think so that is going to work. I said that is exactly what you want to do, because we want to understand what is their real life situations up over there. What are the foods that is available, that is affordable, and how do we kind of a fine tune and redesign those to be able to achieve our clinical goals that we have? Because it has to be on the grounds. So when the patients comes to the hospital, we connect them with a local health worker down who is amenable and accessible to visit these homes, and they give us the details of what they do and what their lifestyle is, their sleeping, their waking, their feeding, their work time, the economy, and all those things. And putting it all together, we will be making a program which will be packaged in the very context of their life, and then see how does that change the clinical parameters, because they cannot afford many of our newer medicines. It's too expensive for them, and their whole eating pattern, their work pattern is very different. So this whole idea is how do we contextualize? And I didn't talk about medicine 4.0, but that is what now the buzzword is about, personalized medicine. So using the high-end technology, how can we personalize the medicine for a person who gets 1 meal or 2 meal a day, and the food that is available is all that they have? How do we personalize it to see that we can still package a lifestyle prescriptions which will work for that person in that area, and my clinical parameters are well within the normal limit to prevent any complications in the future?
Right. So the next question is, what steps are required to formally embed the lifestyle medicine in global medical education and healthcare systems?
So
I have a lot of questions for you, so please be
no,
precise.
no.
Yes.
That's so the key thing what we're looking at is, number one is to put our contents together. Number two is to get technology driven. Number three is we are trying to collaborate with the government. One of the proposals that we have sent is with the Vellore Health Department. They told us that we have got 1.5 lakh diabetics, and we want you to train our health workers over there so that they can effectively reach out to them. So we said, why don't we put it as a study? You have 1 lakh. Tamil Nadu government spends about 700 crores for management of only diabetes. And I said, if I can reduce the amount of medicines for these patients how much will you save? They said, that's a huge amount of money. What are you trying to say? I said, we can do that. He said, how can you do that? I said, let's work on your PDA system, the food that you provide, just a small change over there, and let us see what that does to the thing. So I mean, collaborating with the government, because finally you want all these things should translate within the governmental system, which is a huge system, and how to make it very practical and within the system, so that the patients who are there in the community are finally benefited.
Okay, great. I think you're doing terrific work, and if it is possible in the case of Chennai or in Tamil Nadu, I think it will be great. And maybe the next scale up will be the entire nation and Asia, because you have been part of the Asian Lifestyle Medicine Society. Okay, the next question. According to you, what are the potential opportunities and barriers to adoption of lifestyle medicine in India and in the global south?
Um, I think the first barrier is the ignorance. Many people don't know it. And I think one of the biggest barriers are medical community. I mean, I wouldn't go to the common man. Common man is much more aware, and I think common man's lifestyle is much better than most of our medical doctors, because there's a huge ignorance. More than ignorance, there's a big resistance and acceptance, because let's talk about anything else but food. Please don't look at my plate and tell me what I should eat and what I should not. They feel very personal and possessive. So I think the first barrier is our medical fraternity. And so we are with this all these course training incorporating within the curriculum. The government is ready. We had conversations with AIMS New Delhi, and the director was says, "What do you want?" I said, "We need to change our curriculum. We need to have lifestyle incorporated right from first year to the final years." So education is important within the medical fraternity. We have to figure out systems of how the common man can say translate it in a very natural way in their own existing system, rather than creating a new system and calling them. So while they are studying in the schools, we want to change the environment and the curriculum, what they should do while they are working, going for work. I think Infosys and few other centers and Bangalore, they have incorporated many things. They don't allow fast foods, they have slow foods, they don't allow vehicles, you cycle or you walk. They have some gyms, some swimming pools. So if you can also change the environment within the workplace, many of those things will translate very naturally into a healthy living.
Right, great. So the question is going to be, the next question is going to be very interesting for you, hopefully. If you can predict the future, what is the future of lifestyle medicine in India, lower middle income countries, and the entire world in 2050?
Okay. So it is, I mean, uh, if I have to force myself to imagine, because in many years you feel all these things goes very slow to change, and there are usually a lot of oppositions. But I think even without us, there are things that is already changing. The amount of information that we have, the amount of information that people have, the amount of information that people are searching in the net itself tells you that there is an inherent interest for people to know what will make them healthy, safe, and effective. So that is one very positive things. If you want me to draw a picture of what it would be, and as I see some of the people around, lots of them have actually health apps, watches, smart watches, smart apps up over there. So I'm looking at a time when all these things, if we can, digitalizations, AI app, wearable devices are something of the future that I see happening, and how in a more evidence way right information is provided to every end user. If we can are able to provide it and make it policy wise and mandate across every institutions, from educational institutions to work institutions to the community, if everybody takes the ownership that this is what should happen and what should not happen, if we are able to make policies against it, I think that would really be an ideal world that we can dream of.
Okay, so we go to the last two questions. So how do we make systems inside the broader health systems adapt to each other and make themselves complementary and foster truly participatory collaboration and cooperative engagement? In order to make the goal of lifestyle medicine a reality, I think this is necessary. So how do we go about it?
Um, we are very careful and we are very intentional that any systems that we develop is in according to the guidelines of the government of India. Just using the concept that we have a digital health India, and they have finally come up with certain guidelines with the hope that anybody who's building up any system should be seamlessly integrated with each other if you are following certain norms and the platforms in which we have to do. So I think developing systems which is compatible with what the government is doing, because government has some system, not very robust, but they do have some digital system in which they are capturing a lot of data in their portals. So we want to study those. We want to develop ours because government may not immediately do what we may have to say. It's important that you showcase that this is what works, and once they see that it works, then incorporating it into their system, because we have made it compatible to their system, will make it more easy to get it incorporated within their system, and we can be able to do it. So that's why one of the intention is to do some collaborative study with the government, so that they are familiar with us, we are familiar with them, and whatever we develop is something that we find will be integrated within the system.
Okay, the last question to you before I read out audience question. There are a lot of questions coming for you. So audience, please keep putting the questions in the Q&A, because I'm going to read out to Dr. Hans talk about it at the end. We don't have a lot of time, but I'll try to do justice to as many questions as possible. So let me ask you the last question. What advice would you offer to emerging researchers who want to explore this exciting field of lifestyle medicine in the global south and in resource constrained societies like ours, India, Bangladesh, Pakistan, and all these countries, South Asia, Southeast Asia? So what advice would you give?
So, number one, I would say is that let's be cognizant that we thought as a developing country we had more of infectious disease. That is completely changed. Now we have what we call it as a double burden, and infections are easy to treat. The longest treatment is tuberculosis, 6 months to maximum 1 year, right? But all our NCDs are lifelong treatment. And the way NCDs are increasing, it is not sustainable. It's not financially sustainable for individuals or for the government. And so I feel this is really a pressing need. That is one. Second is it is to do with behavior, which is the most difficult area to address. And so, I mean, if you guys can come with fantastic behavioral change models and all, is where I would say you need to equip yourselves. So, as you equip yourselves, not just with the statistical and research tools, I think psychology is something is very important areas that you need to equip yourself, because knowledge in itself is one thing and how to disseminate it, all those things are fine, but behavioral change and model of behavioral change and how can we do behavioral change in the community among the larger population is, I would feel, is the biggest challenge that you will face, that we face. And we are trying to work in collaborations with social scientists, with psychologists, with behavioral scientists. So because it has to be collaborative, that's the other thing that I wanted to say, that work out with, get people who are interested from different domains and different fields, because the answer to the solution is a collaborative work, working together. You may not be expert in all these fields, and that's why we have a team of people who comes from different backgrounds, and we collaborate and we work together.
Great. I think you have done a full justice to all my questions. So I'll proceed now quickly to read all the important questions that our participants are asking. So participants, if you want to ask any question, please put it into the Q&A and I'll be reading now. Okay. Dr. A.V. Raghavendra Rao is asking, is there any general package of lifestyle for all persons to follow to prevent most lifestyle diseases?
Uh, General package of lifestyle. Yeah, I mean, I guess if you I can only recommend my package. We have our lifestyles medicine book, which is available in Amazon. You can click that, get it. Most of our thoughts has been put together, and these are quite an evidence based by eminent people, directors of AIMS, NIMHANS, Debi Shetty Heart Center, all of them put together. So there's a good amount of work that has been and put together. So maybe that may be a starting point from where, if you want everything put together in one place, could be a resource that I can kind of suggest to you.
Okay, Sefo is asking, thank you, Dr. Samuel, for a very insightful presentation on lifestyle medicine. In your presentation, you shared a slide on let's flip the pyramid. I think the first or second slide. My question is, how can we make public health promotion a pillar of transition towards lifestyle change? In terms of health disparities, how can we ensure that lifestyle medicine doesn't threaten indigenous medicine? Interesting question.
Okay. If I understand your questions correctly, uh, when we look at lifestyle, we are basically going a little backward. Something in our tradition itself was a good lifestyle. The modern medicine has moved us a little away, and most of the time people say, when they talk about the American diet, they call it as a sad diet. Sad diet is standard American diet. So whatever's come newly is really sad, and they are the cause of most of the things. What we have been eating and what our ancestors has been eating has always been healthy. So it's all about going back to your roots, going back to your culture. So it doesn't take you away from your roots or your traditions or culture. It takes you back. In a very simplistic one-liner of lifestyle is follow the nature. The nature will tell you what is good for you. From your diet, from your exercise, if you ask me what time you should sleep, follow the nature. When the sun sets, when the sun comes up, we have all changed that relationship. If one person falls sick in the village, the entire village is there to take care of him. Today, if somebody dies on the next apartment, you have no idea. So a lot of things have changed in the name of modernizations or development. Is going back to the old. So I don't see that it is taking you away from what is traditional. I feel it is taking you back to the traditional.
Definitely. Okay, Chushu Musa from Sierra Leone is asking, he has three questions for you. He says, thank you so much, doc. Please help me with this. What role does mental health play in lifestyle medicine, and how do you address it in treatment plans? Second, how do you motivate patients who are resistant or finding it difficult to change long-term habits? And the third question is, how does physical activity interact with other lifestyle factors to improve the health outcomes? It's almost a PhD level, three questions altogether.
Yeah. So number one is mental health is the core. It's the core, because if you don't understand the person, I mean, anything that you say, he won't register. So connecting with people, understanding them, emphasizing that this is important, number one. Number two is helping them to improve upon their mental resilience, the perspective, the way they see it, are some things that you have to address. I will say sometimes we talk more about diet, and sometimes we fight about the various types of diets which is there. Exercise is little standard, not much fight over there. But what we miss is to really understand the person sitting across your table. So I think I won't go into the details. I'm sure some of you are already into mental health and behavioral sciences. Very important that you have to connect with the person, understand the person. If you don't understand what the person is truly going through, sometimes what they ask you is not their main issues. There may be something else behind it. And I said, what they're asking is a symptom. What is actually underlying is the root. If you're not able to reach the root cause, very less likely you'll make any difference. So let me answer you. It is the most important thing, and addressing that will take care of all the health issues that they have. And the second thing I want to say is each of the lifestyle parameters actually enhance each other. A good diet helps your brain. A good exercise also helps your brain. A good mind makes you feel hungry and eat the right things and make you do exercise. So each of them, in a way, kind of put you into doing each other. So that's how our body is interconnected.
Right, right. Stella Kokricha is asking, is there a place for supplements in lifestyle medicine?
Sorry, miss it. Is there a?
Is there a place for supplements in lifestyle medicine?
Yeah. So, really speaking, if you're eating the right things, you don't really need supplements. Unfortunately, in a medical science, is becoming a commercial science. So anything that sells, people make it, package it, and sell. And people are so paranoid that by putting in pills. Let me tell you one thing. All studies done on vitamins and minerals have not shown any mortality or health benefit. Every study on fruits and vegetables has shown its benefit. So that answers your question, because fruits and vegetables vitamins, but the moment you take it out of the food and package it into a capsule and tablet, doesn't work. So what works is as it is in nature. So most of the time it's there in the nature, as whatever we need in our body is already there. People want to make a good business out of it by advertising various things, talking many things, and talking a lot of things. I'm very intrigued and impressed by the ideas that they come up with, and the promotions that they do. But really speaking, most of the time you don't need supplements unless you have a deficiencies.
Yeah. So we have Swaliho from Sierra Leone. He's asking, can lifestyle medicine be integrated with indigenous knowledge for holistic comprehension for indigenous people?
So when we say holistic, we are really speaking about that holistic can be in any group. So it's not the biggest challenge we have is to bring holistic in our current medical system. It's more easy in the other system, because most of the system, I was talking to people from homeopathy and Ayurveda, they are already quite holistic. And indigenous people itself have a holistic system within the community, where many of the things that they do is very, very much lifestyle compatible. If you have a medical person who has a lifestyle background, can study many of these things. If you have particular indigenous community in mind, where you can look into those and see which ones are scientifically sound, which can be practiced. There can be some practices which may be not healthy. Those may have to be specifically looked into. But holistic seems to be already there in most of the traditional practices, which I would feel you don't have to struggle to bring in holistic over there.
Okay, so I have the last two questions for you, because there are lots of questions still pending to be asked. These are the two questions. Malavika is asking, sir, do you believe that eating incorrectly is a tendency? And the question number two is also on the eating. What strategies would you employ to increase protein consumption among the people with cultural dietary restrictions?
Uh, diet is a big topic. Some of the biggest challenges we have is with regards to taste, because once you get to a taste, you don't want to give up. And one of my professors, he said that, Sam, um, in life there's one pleasure, that is food. If you take that also away, then what is left in life? So you have to address the issue of taste, and this is what my response is. Taste is a learnt behavior. There's nothing inherent in the food that makes it tasty or not tasty. If that was so, a North Indian should like the South Indian, and the South Indian should like the North Indian. They don't like. Why? Because they have learnt that behavior, that over a period of time, when they keep taking that food, you get used to it and you like it. So if you're going by liking and the taste, it will take you away from health. You should first know what is good for your body, and then train your body to get used to it. The taste can be changed over a period of time. And so the first thing is to know, because we have five senses, and if you go by senses, you will land up something very different. So you cannot go by senses. Your brain should dictate your senses as to what they should do, and not just go in a sensual, we call it as a sensual life. If you live by your senses, you will live a very different, depraved life, which will put you into a lot of health issues. So first you should have a clarity, what is good for me, what is not good for me, and then train your senses. Because what we have found is, when you train your senses in doing good things, they will keep you healthy and keep you protected away from other things.
Excellent. So I think there couldn't have been a better end to this session. So it is my utmost pleasure and privilege and honor, Professor Samuel George and staff, to welcome you on the stage of Global Consortium of Global Health, and also to be able to interact with you and moderate this very beautiful, very insightful, erudite panel discussion that we just had. And as I can clearly see, the questions are increasing in the Q&A section, and that testifies that they have a lot of enthusiasm. They are really enjoying your talk, and they have benefited greatly from your talk. And with this, I would like to inform you that our Global Advanced Certification Program is attended by more than 1,000 people. Okay, this is a tradition of our Advanced Certification Program that all the resource persons who come to teach them, we are creating two certifications for them. First certification just is a certificate of completion based on the grade and everything. The second certification is a special one in the format of UK and Australian higher education standards. We are calling it higher education achievement statement. And on that statement, it will emboss all the signatures of all the dignitaries who have come and taught them every weekend. So far, more than 12 people have come and they have taught them, and all their signatures are going to be printed on it. So our admin team would be in touch with you very soon with the request with a thank you note, with the request for your study material, means resource material, like the slide that you just presented, and as well as your e-signature. So I would request, please do the honor. And second thing, I just want to inform you that we are not a highly funded organization. We are a very crowd-funded organization, so we would not be able to give you any honorarium or any form of souvenir, but we would like to just inform you, sir, that we have a letter of appreciation which we are preparing, and that would be delivered to you by our admin team again. So with this, I would request Faisal to take over and do the dues. And thank you so much for coming on board and having this intellectual discussion. And I think our participants have benefited greatly because they were very, very excited about your session. And I think looking at the comments which they are putting into WhatsApp groups right now, I can say that they are actually enjoying it quite a lot. So with this, thank you so much, and I look forward to the future opportunities to interact with you and collaborate with you. The Global Consortium of Global Health, the Global Health Forum, as well as the Global Brain and Mental Health Forum and the Bangladesh Institute of Innovative Health Research wants to thank you and put forward the word of appreciation and this acknowledgement of our appreciation in this regard. And we look forward to future opportunities to welcome you again on our platform so that you educate us and you enlighten us with your wisdom and your experience. With that, Faisal, over to you.
Thank you, Professor Satpathy and Dr. Hansel, for such a compelling and enlightening discussion. We learned a lot about lifestyle medicine today, and hopefully our participants enjoyed the whole session. So we will now take a 5-minute break for our participants to move on and get ready for the second panel discussion and return shortly for our second panel. So thank you, sir, for coming up and delivering such a wonderful session.
Sure. Thank you so much, Professor Maheswar, Satpathy, and the whole team. It was an honor and privilege to me, and we are happy to share whatever we know in any way. And we wouldn't be expecting anything in returns except your appreciations, and we are happy anytime that you would want us to interact. We'll be there to be a part of it. So thank you, and wish this initiative that you have started. It's wonderful to see so many participants so excited in this journey. So we hope and wish them all well in the days to come, that they would really learn, use their skill, and use it for humanity in whatever ways they can. So thank you so much.
Definitely. Thank you. Have a great weekend. Thank you.
Sure.
See you. Okay, so we take a quick break of 5 minutes. We exactly return at 7:40 p.m. Indian Standard Time. Okay, and the session will start. Please use the time to take a little bit of fresh air and maybe for the bathroom break, and we shall return and resume our session. Hello, Gareth. I'm very happy to see you. So
Right,
I hope you're doing well. Yes, yes. So we'll start. Just give me 2 minutes. I'll join you in 2 minutes.
Yeah. Take your time. Take your time.
Yeah, sure. Gareth, if you would like to have a quick run of your slides, if they're working well, then maybe you can do that and let the participants join. We'll start in 2 minutes. So participants, we are going to start in 1 to 2 minutes time. So please join up as soon as possible because our esteemed speaker has joined and we are going to start very, very soon. So how is your Sunday going? I hope it's all fine.
Yeah, great. Like it's yeah, busy with the kids on a Sunday, you know. So it's but oh no, I'm looking forward to this. I just caught the end of the last speaker. It's excellent. Leads in very nicely into this holistic approach, and of course, mental health plays a big role in that. But yeah, we'll go through that during this talk.
Yes, that's how we structured it. Like we thought, like
Yeah.
your talk would fit very well with that.
Yeah, perfect. Absolutely. Yeah.
Right. Okay. So yes, now we are 39. So Hazel, are you here?
Yeah.
Are we ready?
Yes.
So let's start. Yes.
Okay. So welcome again, everyone, to our second panel discussion of our session 7 of the Global Advanced Certification Program and International Workshop Series. So the title of this panel discussion is The Future of Healthcare, WHIS, Empowering Communities, Enabling Better Health. Joining us today, Mr. Gareth Press, founder and CEO, World Health Innovation Summit, CIC, and CEO, Global Social Prescribing Alliance. Moderated once again by our esteemed Professor Maheswar Satpathy, CEO, Global Alt, and Director, COE, ECCPH, India. Professor Satpathy, we invite you once again to introduce our esteemed guest, Mr. Presk, and open the floor for this critical One Health discussion.
Thank you, Faisal. Okay, so because my introductions are already done in the first session, so they don't need to actually listen to again, you know. Okay, so Gareth Press, it's my utmost honor and privilege to welcome you on the stage of Global Consortium of Global Health Actors, Leaders and Thinkers, and it's my honor and privilege also to welcome you as the keynote speaker for the session number 2, panel number 2. Okay, so let me do the honor of reading your bio, which is nothing sort of exemplary. Gareth Press is the CEO of the World Health Innovation Summit, WHIS, and the Global Social Prescribing Alliance, where he leads the global efforts to transform health and well-being through innovation, prevention, and integrated care. As the founder of World Health Innovation Day, he established a global platform celebrating pioneering efforts in health innovation. Gareth is also partner at the Commonwealth Pacific Climate Fund, promoting sustainable development and climate resilience in vulnerable regions. His work bridges the health, climate, and economic growth to empower communities to thrive. He previously served as the Chief Officer of the National Haemophilia Council in Ireland, a country that I really love, where he championed patient-centered care and national service improvement. During the COVID-19 pandemic, he was appointed as a member of Pope Francis' Vatican COVID-19 Commission, contributing to global health and ethical recovery strategies. A recognized thought leader, Gareth is dedicated to creating inclusive, scalable solutions that address systemic health inequalities while aligning with the UN Sustainable Development Goals. His work connects policy, community, and innovation, making a lasting impact on the public health and sustainable development globally. With this very humble bio, which doesn't even do justice to the kind of work, the breadth of work that you do, Gareth, it is my utmost honor to invite you to illuminate all of us with the brilliant talk that I am actually waiting for a very long time to listen to. And after that, it will be followed by the panel discussion, which will be about 30 minutes. Your talk will be about 30 minutes, and then that will be followed by a audience question and answer about 10 to 15 minutes. With this, the stage is all yours. Thank you.
Thanks. I'm really grateful for this opportunity on a Sunday afternoon, and just listening to your previous speaker, just briefly, I hope that this will give a lot of us some thoughts for future action and how we can actually deliver, not just for our own communities, but for our wider communities, because I think we need to work as a collective. So very simply, I'm going to talk about the World Health Innovation Summit, the future of healthcare, how we can empower communities, how do we enable better health. First and foremost, we have to do it as a collective and break down those silos. So I just wanted to explain to people that it can't be just me or Professor Satpathy. We have to do it together. So it's got to be me, you, we, us, and then that drives humanity forward. And I think we've got a lot of knowledge, but we don't necessarily have a lot of wisdom. So hopefully we can share that wisdom today. A little bit of background just to set the scene and give some context, the work that I've been doing over the last 25 years. It actually initially started with charitable work. That's where I kind of came up with a lot of these concepts, because I believe we don't value that charitable work the way it should be. We value banks and we value money, but we don't necessarily value the humanity in us, which is where I think we will go in the future. So I've just given you some context here, a little bit about working with the Vatican, setting up the Global Social Prescribing Alliance, engaging with UN agencies. More importantly, over the last couple of years, I've started to focus on investments, and I think that's going to be a huge opportunity for the healthcare sector to work closer to financial institutions, and that's what I've been trying to build bridges and navigate that system. COP, of course, engaging with climate and health, that's the next nexus. And then you mentioned One Health. Interestingly, I've published a book. I wrote a chapter for a book recently on One Health. So all of this sort of comes together at the right time. Now, the future of healthcare, what does it look like? Okay. On the left-hand side is what we are used to, which is managing sick care, disease management, which is what we're excellent at. We're very good at this, but unfortunately the system is failing. And I'm going to give some examples of that, but it's not sustainable. But the huge opportunity is on the right-hand side, where we can actually strengthen health systems, improve our health and well-being, create new and meaningful jobs. And I don't just mean a small number of jobs. I talk about millions of jobs here that we can actually create. And the health sector is the key. It can actually tap into this knowledge stream and we can move forward. So I'll go back to One Health again. This is fascinating. Pre-pandemic 2019, I was standing up on the stage explaining to our colleagues around the world that we were going to be hit by a pandemic, because many people predicted this. And if we go into the detail in terms of staff shortages by 2030, we know we're going to be 18 million staff short. But please don't see that as that's actually a huge opportunity, because that's on the disease management side. As I said, on the right hand side of my diagram, we've got this preventative model of healthcare. The statistics that I'm sharing here are all very, I'm sure you've all come across this. We have enormous problems with recruitment and retention all over the world. I know in Africa, they'll be short of 6 million staff, for example, by 2030. So we've got enormous problems here on the health sector side. On the climate change situation, and this is all one holistic approach if we move into it, You've got the situation like we've had so many people displaced in Pakistan recently, you know, the humanitarian droughts. And then also in modern, in NHS, for example, we spend over $1 billion annually from cold homes in the NHS. So it's a massive problem. And we have about 13 million people annually who die just from climate change alone. So everything is connected. It's all, if we've no water, no health. I want people to understand the amount of money involved in this as well, because it's enormous. We're talking about trillions of dollars here, which is invested in fossil fuels, and the cost from an economic perspective is about 8 billion a day. It really does blow my mind. And then you have to understand the health sector as well, our pension funds. So the pension funds within the health sector actually finance a lot of this, which is just crazy. It's hard to believe, but that's what happens. In the UK, I wanted to just give some context here around how the economies now of the world are being dragged by ill health. Okay, so you know, you see a UK economy at the moment, and we've 2.5 million people sick. And these are people who are not working, they're inactive, they can't do anything. Now that starts to pinch the exchequer. It's about 150 billion pounds annually that this is costing. And keep in mind, we put about 200 billion into the NHS. That's nearly close to 350 billion pounds in 1 year. I mean, this is a huge ticket item, and this is only in the UK, by the way. Now, if we switch that and we prevent this, we will create an economic uplift. And this is the beauty of this for the preventative side and for lower middle income countries and developing nations. They can supersede and learn from these mistakes. Do not follow this same path, because you will end up with the same outcomes, unfortunately. We know there's huge problems with dementia. A lot of this I put down to nutrition and food, and we heard our previous speaker talk about this. Diet is a huge problem. You know, we have obesity levels spiking. So these are all things that we can offset if we start early. I'm covering the sort of context of shall we say disease at the moment, but I'm going to move into sort of what the future will look like in terms of prevention and the real opportunity. I had to bring up this contaminants of emerging concern because this is pesticides. This affects our fertility. This is a huge problem that we have to step up to the mark, again linked into climate change. You can see the contaminants. You can see, for example, even contraceptive pills, which are dumped down the toilet, end up in our food chain. This causes enormous problems for the fertility of the future. So we need to be also mindful of this as we go forward. As a whole humanity and a society, we need to address this quite rapidly. A previous speaker was talking about mental health. And it's very clear to me, having been in the health system for many years, that this comes down to very early years. And you can see what happens to children when they have neglect, or they just in the first 3 years of life. And for me, this image here is how we transition, because what we have to do is invest in early years, preconception, around the family. This will offset enormous economic costs as we move forward. You'll find most people with extreme neglect are those who unfortunately get involved in crime, have lack of empathy. So these are real issues, but can be offset just by a bit of kindness and also by a bit of common sense. You know, this is really important stuff here, but a lot of this is not rocket science. It can be done with early intervention and just some common sense. I wanted to just highlight this statement because, you know, doing the same thing over and over again, expecting different results. This is what we do in the healthcare system. For example, NHS England are just going to put another 30 billion into the health system. You know, there's billions of pounds pumped back into a health system which just is not functioning. It's not going to function. It will just continuously spiral, unfortunately. We can't retain staff. There's too much pressure. There's too many people coming onto the system, and we need to look at new ways of offsetting that. That's the only way this is going to work. So how do you do that? And part of the work that you've initiated, Professor Satpathy, and me speaking here today, this is the start. The ball is rolling. We've been starting this process, but it takes a long time. For health systems to adopt innovation, it takes about 17 years. 17 years, even if you have the evidence. Okay, so this is not good. Okay, but we have to work collectively to push this forward. But we're at such a crisis point within the health system that I believe it will get very political over the next 4 years. Mark my words, the pressure that's going to come on the health system and the demand and the pressure on the politicians and those leaders will come tenfold, because we just don't have enough people to cover what's needed. So what is the plan? What have we been doing? This is what we've been doing here in the UK and around the world. We've been prototyping it. We've been failing. We've been getting it right. And we've been learning a lot. So what we suggest is give people the tools to manage their own health and well-being. Very, very simple. And you can do that in any community. You become apolitical. I used to advise ministers of health for years, and I understand how the political system works, but you need to really focus on the communities. And if you look on the left-hand side, that's a community in Nottingham, and that's what we did. We were giving people the tools to manage their own health and well-being. And the platform is World Health Innovation Summit. That could be Cape Town, that could be Kinshasa, that could be Mumbai. And you use this as a springboard to share knowledge, right? And at the same time, you introduce programs that are used to offset these problems, these ill health. So it's important to understand the financial structure, right? People, me and you, we make decisions. We are where capital flows. When we decide to support a business, they're able to raise investment. It's so important. Look at Tesla is a fantastic example of that, right? You see how much the stock has fallen because of individuals' actions. So in the future, let's make a call and support businesses that are social minded. Our business model is to generate cash flow and reinvest it back into local communities so the money stays local and the individuals locally benefit. You create jobs locally. It's a win-win, and it just continuously spirals. This will be the future. You'll see that, and investment is going to flow into this quite quickly. That's what we've been advocating for. So when I talked about giving people the tools, how do you do that? This is how do you actually make this all come together? By the way, it's difficult. It's not easy. It takes a lot of work, and you've got to be really committed to it. Just as Professor Satpathy is doing here, you've got to be committed. We're working on a Sunday, as you can see. You've got to really put your heart and soul into it, and you really just got to go for it. And, you know, forget all the naysayers, just go for it and do your very best. But I do believe healthcare can lead on this because of the ethical side that we have on our side. We're trusted when we do work. The reason I joined the health service was because I wanted to help people. Plain and simple. It's not monetary driven. It was to help others. So that's why I joined the health system. Like Professor Satpathy said, I left my job, like he did, I left my job to pursue this, right? I didn't have like money behind me. I decided I need to change this. I have to take responsibility for this. Nothing else is going to work. We've got to do it ourselves. You've got to take personal responsibility, and you've got to step up, and you've got to step out of your comfort zone, and you've got to fail, and you've got to fail and fail and just continuously push forward. And it's about losing the fear. And then the benefits are for the wider community, because that's what we're in this for. We're trying to push humanity forward. Okay. So tools, WisKids, we very simply, how did I set up WisKids? I went across to my local school where my children were. I walked in and said, would you like mental health services? But what I brought was my acumen and my experience from the health sector. So I was able to develop programs that were very tailored towards children's mental health and well-being. So that's what WisKids is, looking at children's mental health and well-being. WIS at work, stress management in the workplace. WIS seniors, falls prevention, loneliness, quality of life. WIS green, energy, wastewater, all connected. So it's very simple, but also you're bringing your clinical and your knowledge from the health sector to the communities. That's one of the advantages of COVID-19. What did we do well? Working in communities. Don't retrench, go back into the communities. That's where the opportunity is. So these are just some of the case studies, some of the work I've been doing over the last couple of years. we worked with NHS. We were offsetting their costs from a primary care perspective. So we were giving clinical we were working on a wellness days in Furness and Barrow here in Cumbria. And then I've been doing some lecturing all over the world with medical students in Indonesia, for example. So trying to share this knowledge so that we can actually grow. We want to shall we say, become a platform that can be trusted. It's very important that we maintain that trust. Everything is evidence-based as well, so it's important that we maintain that sort of strategic element. These are just some of the examples of the work that we've been doing when we were prototyping. We were in Blackpool, we were in Birmingham, we were looking at disabilities, inclusion, we started in Cumbria, and we used the digital tools that were available to us. It's fantastic to see today, you've over 200 people online here. When we were starting our Cumbrian events back 10 years ago, we used Twitter and X at the time. We were able to reach 20 million Twitter impressions over the course of a couple of days. It was phenomenal, the response. It was really because the medical paternity groups around the world, they use Twitter a lot. Just to give you, I mentioned One Health. There's a chapter in One Health, this book by Piero Formica, an economist. We were also looking at, we published documents and magazines, space medicine. We were looking at COP. We were incorporating everything, because you can see now you can tap in through health sector into all different facets of lifestyle, whether it be media, marketing, whatever. And these are all to build trust within your community and share that knowledge and information. You have to have impact, you have to measure impact. This is just some of the independence. So again, when we did this over the first couple of years where we were prototyping, I went and I employed an independent consultant to go and do a review. This was the initial review around our pillars, the work we were doing, the goals. We wanted to restore the balance of the environment and poverty, improve people's health and well-being, support the most vulnerable. And we were doing this through our 5 pillars: with kids, with at work, with seniors, green and tech. And you can see the impact was phenomenal. So again, when we started all these programs, I ensured, having worked in the Department of Health, I knew that if I was going to go back to commissioners or I was going to back to funders, they're going to want evidence, okay? They're going to want to know, how does this work? So I basically, when I started with kids, we made sure we benchmark everything. We measured everything and we got feedback from everyone, because that way I was able to go back to the commissioners and say, hey, for every £1 you invest, you get £7.50 back. And in total, it was £1 invested, 36 back. Okay, and people were asking, how could you get such numbers? It's quite easy. If you have a suicide in the UK, the cost of the suicide is about 1.5 million. Right? That's the cost to the exchequer, because the government loses tax. Right? And so everything has a cost. When people say they can't measure, you can measure everything. Everything is measurable. I worked in the government for many years. We measured everything. Once you have time, you can measure it. Okay, so there is a lot of effort that goes into this. Sort of some of the aspects where we were looking at, how do you provide care and how do you provide hospital services? Make sure it's patient-centered, of course. Given the restraints and the restrictions that we're going to have in the future, you're going to have to consolidate services. You're going to have centers of excellence. That's going to be the future. Rural hospitals, they're going to need reforming for day surgery, polyclinics, community health services, social and information prescribing, which is what we're going to move into shortly. I'll talk about the Global Social Prescribing Alliance. And all of it has to be ethical. It's got to be transparent, open, honest. You've got to be very upfront and share that with everyone, because I think we're in an environment now at the moment where we need this transparency. That's what's really going to, trust is going to be the oil of the future. That's where we're going to go. We need trust and transparency. So WIS is a preventative healthcare platform which empowers people to improve their health and well-being by facilitating community engagement. It's all about the community. And the beauty about all of this is it can be transferable to your community. It can benefit you and your family. And you can really develop new models of healthcare based on prevention. And for years we've talked about, well, you know, who's going to pay for this? How? The reality is, and I've given you the evidence, you know, ill health is costing 150 billion. There's no value to that. We're not creating anything of value. That's all negative. Whereas if we keep people fit and well, they can have a job and they can keep moving forward. That is economic growth. Okay, that's the future. And what we're doing, we're creating funding vehicles, blended financial funding vehicles, where investors can put money in. And if they want a return, they can get a return. But we can also take grants. We can do lots of different things. You blend your capital structure. So we can cover antimicrobial resistance. We can cover digital health, women's health, social prescribing, aging clinics, space medicine, you know, health infrastructure, wellness as a service. All of these things can be facilitated, right? You can generate capital. You can make returns, which, as I said, creates jobs, and then you reinvest that back into the local community. This will be a future business model that will be replicated all over the world, because that's the future of society. We're going to support businesses that do good in their community. Anyone else not on that page is going to be left behind, unfortunately. Well, that's the reality. We just came back from Bologna in Italy, where we started. We're mobilizing this. Our plan is to go to 100 cities in the next 5 years. We're working with some anchor institutions out of London and investors to mobilize the capital to be able to grow this. That's the future plan. This is sort of the social prescribing element, which was initiated by the UK government. They sort of pioneered this. The UK Secretary of State launched the Global Social Prescribing Alliance in 2021 during the pandemic. Social prescribing is a way of offsetting, shall we say, patients towards primary care, towards a link worker. And we're creating an international community of practice, implementation champions, research and academia, workforce development and policy. These are all new jobs, okay? All new jobs. And this is being adopted by governments all over the world. You can go on our website, you can download the social prescribing playbook. It's there, it's all referenced, it's free. You can take as much advantage of that as you want. And then Professor Satpathy will also be joining us for the Global Social Prescribing Summit on the 25th of July online. So really looking forward to that. And I hope everyone here can join us. But this is a new movement. To give you an example, in the UK, they've invested £450 million and they have about 3,000 new link workers across the UK, and they're working in primary care with their GP. And instead of getting 10 minutes time with just your GP, you now get an hour with the link worker, right? And then they will refer you out to community services, such as, you know, looking at holistic approaches to health and well-being. So it could be gardening, it could be art. So there's different ways in a creative sort of environment for you to offset your mental health issues. One of the areas you mentioned earlier was the World Health Innovation Day. So I came up with this concept. Let's empower local communities and give people the opportunity to create this innovation in their own community on a day, right? And the whole idea is to sort of say, on the 2nd of August, create an event or activity. It could be a walk, it could be a swim, it could be a run, it could be a game of golf, it could be tennis, but get physically active, right? And then let's mobilize a giant community around the world, and let's mobilize capital into charities. Because your local charity, you can just generate cash flow just through World Health Innovation Day. I don't want to know about it, just go do it. It's about creating community opportunities. On the 24th of October, we plan to start one of our major initiatives in London. And what we want to try and do is mobilize this on a global scale, as I said, and encourage people to take this into their local community. And that's what I hope we're achieving here today. This is sort of like WIS, you know, working together for healthier communities with innovative solutions, delivering sustainable growth. I'm sure you have lots of questions, and I'm very happy to take any questions that you may have. But that's sort of my presentation. I hope it's been insightful. I can share this online. You can connect with me on LinkedIn. Yeah, I'm excited. I'm very excited because, as I said, while the health system is struggling at the moment, the opportunity in this whole wellness sector and well-being is just enormous. And that is where future investment is going to go.
Excellent. I think you're precise on time. That makes my job much easier, Gareth. Actually, because I have lots of questions for you. So
Okay, fire away.
yes. So participants, please feel free to drop your questions in the Q&A section, and we shall be picking them up at the end, and we'll be asking Gareth all those questions. And we'll see if we have time. We'll also go to the point where we may allow you to even ask questions directly, provided you follow the order. Okay. So let's jump with our panel discussion now. Are we ready? Maybe we should have a little bit of water or something, because I'm having, you know.
Absolutely. Cup of tea.
Yes. Oh, great, excellent. Sunday afternoons. Excellent. So you just made a terrific presentation, and I'm very happy with this. Being a close friend, I think I'm very happy to have you on our platform. And I'm going to ask you a few questions which will provide you some potential opportunity to explain further, narrate more about the WHIS and global social prescribing alliance. So with this, I start. The questions will be a little bit of quick fire of questions, so you feel free to elaborate as much as you want, but we have many questions to go. So Gareth, as the CEO of WHIS, can you please tell me more about what motivated or inspired you for the creation and conception of WHIS, and tell us more about its long-term vision and mission, and how is it transforming the community-based health in particular?
Yeah. So very simply, it was my children. I have two young girls, and they're 12 and 9, and I have to look to the future. And when I look to the future, I see problems, and I realize we cannot continue on this path. That was one of the main motivations, but also having worked in the health sector and witnessed my colleagues leave, very experienced people leave the health service due to burnout. And I realized that this is not sustainable. And unfortunately, what happens is the people who have replaced those colleagues who basically, like me, committed their life. I used to start work at 7 in the morning and I would leave the hospital at 9 at night. Okay, I was crazy. And then I'd be back in the next day, and my colleagues would do the same. We did it because it was a vocation, but I soon realized that that had changed and it become more of a KPI exercise, and more litigation, more and more problems. And you had a sort of, unfortunately, colleagues just got burnt out and they left. And these are very good people, very experienced. And I just seen that happen over and over again. And that's what's happened to the health system, unfortunately. And we don't value our people enough. And that's why I sort of said, well, we need a change. We need a new approach. I've been very lucky in my career to work with exceptional clinicians. And the biggest lesson I had as a manager, because I was a manager within the health system, was I understood that a clinician like yourself needs time to treat. That's it. They go to college to treat patients. They don't go to college to punch in numbers into computer screens. That's not what they do. So I understood that, but the health system, unfortunately, is in a bad way at the moment. We've seen the confidence even within the community has gone from 80% in the UK now down to 20%, and that's replicated all over the world. And we're fortunate we have a certain amount of healthcare here, which is universal health coverage, but it's not where it needs to be. And unfortunately, now I do my very best to keep me and my family healthy through nutrition and exercise, just as your previous speaker mentioned. We have to take responsibility. So that's it. The future vision for WIS really is about getting the support, mobilizing. I'm hoping that this vision can be replicated and sort of, as I said, I live in Cumbria, I'm Irish, I'm from the UK, I live in the UK at the moment, but this is my community. You live in India, and people on this call will live all over the world, but that's your community. What I have is experience and knowledge, which I'm more than willing to share, and all the failures that I've had. If it makes a difference and we can improve the health and well-being for one or two people, fantastic, we've done our job. But I do believe we have an enormous opportunity here to be able to do something very unique and transition healthcare from managing disease to prevention. And that's where I believe the future is.
Exactly. I think while we talk about management of healthcare and to make a transition from disease management to prevention, we have been talking about it for quite some time now, but we are not seeing much of a result in the sense outcome, successful outcome. And one of the things which you also said about is like sharing the failures are equally important as the successes. Many times we just cherry pick the successes. We do not talk much about, we do not examine and dissect the failures. And I think the answers to most of the questions we are looking for lies in the failures. Why do we fail? Like we have spent billions of dollars and pounds on healthcare and still we are failing. Like look at the system like NHS, one of the most advanced healthcare systems in the world, and they take pride in it. They teach it at the universities where I have studied, like Cambridge and UCL, and they teach you like this is the best health system in the world. But then I have fought and argued with my professors while I was a student, saying like, no, I do not quite agree because there are a number of things which you are not talking about. You are only talking about the successes. You are not talking about the failures, right? So going a little away from my set questions, I would like to ask you one very intimate question that I and a lot of my close friends in the UK are basically talking about. What is the future of NHS in your experience and opinion? Like, where are we heading?
Well, I think unfortunately the NHS is in a, unless it changes quite rapidly, I don't think there's much of a future for the NHS, and I think we have to be very honest about that. I think because the situation. So let's put it into context. If you talk about the NHS, we have 7 million people waiting for elective surgery. Okay, 7 million out of a population of what, 50, 60 million. This is an enormous number. Okay, now we all know if you're waiting for elective surgery, it's very soon you'll end up with a heart attack because the pressure on one of your arteries will eventually. So you'll die from that. Okay, so there's enormous. The problems in the NHS are so vast at the moment, and you have a huge staff as well. And like, so the NHS, from my perspective, and also I mentioned the huge problem of not adopting. You're talking about the evidence. The evidence is there. I've shown it to you. I've given it to you. I've stood up in front of all those leaders and I've explained this to them. What we are lacking here is leadership. There's also a real, there's not enough understanding of economics and healthcare. Okay, as I've explained here, look at the numbers. It's incredible the amount of money that has been wasted here, right? And remember, we have in the treasury, we have, for example, you have vacancies, right? You have thousands of vacancies. That's money sitting in the treasury. Just move it into social prescribing, for example. It's about thinking differently, and it's changing the mindset. We have a fear-based mindset. We also have this mindset that there's no money. But go to any of the financial institutions or go to a financial conference. Just go and see. I encourage you to go and listen to the chief investment officers and listen to the likes of Allianz or listen to AXA or listen to Deutsche Bank or HSBC. They'll tell you, or the sovereign wealth funds. Look at all the money in the UAE. There's billions and trillions of dollars waiting there. What they're lacking is projects, and they want and they understand the financial world as well. A lot of people look at, well, I have a project that's 500,000. Okay, but bankers don't get out of bed for 50 million. So you need to collaborate with someone to bring your project up to 50 million, and then you get an opportunity. So we need a new way of thinking, and that's why I hope my experience over the last few years knocking down doors. It's very difficult to get into the financial world. It's really difficult. They don't, so that's what I've been doing. I've been showing up. I've been going to workshops. I've been invited to Abu Dhabi. I went to the annual investment conference. I gave a workshop on the future of healthcare. I'm building the trust. It takes a long time. It's a huge investment. This is something that doesn't happen overnight. If you're going to raise money, a lot of people want a quick win. They expect money instantly. It takes years to do this.
I think that's something which needs to be acknowledged often, especially in a field of health entrepreneurship, because healthcare is not a field that gives you easy returns of investment, until unless like you are creating a hospital or something of that sort, where you see patients daily and literally do something like that. Okay, I'll go to the second question that I have for you. So you have the WHS, which is obviously making very good progress, and I've been having discussions with you. How is it different from other health conferences such as the World Health Assembly, which we just had recently, and the World Health Summit? They claim themselves to the largest global health summits, which is true in terms of statistics, but we just had the Global Health Summit regional meeting hosted in India. How is WHS different in terms of mission, vision, objectives, and ways of functioning, its goals, agenda? How do you see that? Would you like to elaborate a little bit more? Yeah.
So I engage with communities. Our conferences are for everyone, right? There's no one. We didn't charge anyone to go to Nottingham. I didn't charge him £1,300. I just said come along, because there's a value proposition there anyway. And I'm also like, the conferences that you mentioned, what are they doing? Like, what I mean, I'm not being smart. I'm just trying to understand, like, what is it that they're trying to achieve here? Because I've been listening to the same talks over and over again, and the reality is you're talking to the same
Every
people.
single year.
Yeah.
Every single year, every same person. Not change. Faces are not changing. Things are not changing. Nothing is changing.
Exactly. And communities know that. And what I would like to do is, with yourself and others, I would like to build a community that is listening and understanding the community. I understand the needs. I see it here. I don't have to go very far to go and understand that we have alcohol problems, we have homeless problems, we have all these problems. And if you're not going to address those problems, then what are we doing? Like, so we have to understand people's issues and challenges and listen. But in those forums that you mentioned, unfortunately, they're closed shop. That's the reality, right? It's the same people saying the same thing over and over again. And I'm not doubting that they have the right intentions, because I'm sure they do, but things have to change. It's not working. And you cannot keep putting money into the same thing because you get the same result.
The only change I think which happens every year is the new theme which is set to make it more politically palatable and make it more sensationalized, and I notice that every single year happening.
Well, what I'm interested in
Possibly.
is just working in the community with local people. So you'll see the event that we had in Nottingham, and I'm looking forward to being in Mumbai or Delhi, or but also it has to be generated by the local community. For example, Bologna, where we just came from, our Italy launch. Everyone was saying, why didn't you go to Rome? Why didn't you go? Everyone was like, why are you going to Bologna? Well, because Bologna welcomed us. Bologna was the one who said, come. And we said, okay, we'll come. So when we did it, and it was run locally, it was run by the local competency center, it was run by the innovation center there, and we got the support. And all we did was share the knowledge. That's what we did. But what we want to do is bring a financial structure that works for everyone. So that's what I'm trying to do. I'm trying to raise capital to support the growth so that we can go to cities, bring in a financial model that works long term, and then make it sustainable and create jobs. That's the purpose of it, and attract investment. So it's an opportunity to have an event, an activity to bring in investors. And then if the local community, they need a water station, they need a waste management, they need social housing. Okay, let's address that. Let's build those. Let's raise the capital, and let's mobilize the community so that they can make informed decisions.
Right. Okay. You have a lot of vision and ambition, Gareth. I hope, as you just told me yesterday, that we have a lot of work to do together. I think
a lot of work.
Yes. Exactly.
No shortage of work.
Yes, definitely it will work out. We'll do it. Okay. The next question. You are also the CEO of you are also the CEO of Global Social Prescribing Alliance, which you talked briefly about. So what is social prescribing? Because people across different disciplines are here. So would you like to explain that? Why is it relevant? And how does social prescribing reshape the traditional healthcare narrative?
So what I've just been describing through WIS is sort of activities and tools within the community. And how do you anchor that into the primary care health system? Well, what social prescribing does is through a link worker, as I was explaining. So usually you go to primary care, you see your GP, and the GP will refer you into acute hospital or into a service in the community. And they only have 10 minutes with you, okay? So it's very curtailed, it's very quick. So in order to get to the root of the problem through social prescribing, we've created what's called a link worker. And the link worker then takes on a caseload and then sends those individuals, those patients, to the community. So it could be green social prescribing, which is a mental health sort of activity, which is maybe, it could be walking, it could be gardening, it could be artistic work. Men's sheds is sort of an example. And that's what social prescribing is. And what's happened with the Global Social Prescribing Alliance, there was an informal network that was set up around the world, which was looking at social prescribing from a grassroots perspective. And what myself and James Sanderson, who is the CEO of National Academy of Social Prescribing in the UK, we basically said, let's formalize an alliance and make it professional so that we could actually make projects that were bankable for investors. You see, so, and that's what we started to do with the Global Social Prescribing Alliance. And the plan is to, with our WIS cities model, is to bring social prescribing to all those cities. So to anchor it into the primary care health system. It's one important point to make here is that the health system can be like a circular economy. So I have to sort of explain this. Health systems are full of individuals who are high earners with disposable income. Okay, they also have a supply chain that can sponsor events and activities. And when I was fortunate enough to be chief officer of the National Haemophilia Council, I knew how much money was floating in the system for sponsorships of events and activities through different partners. Well, why not mobilize that through the World Health Innovation Summit and actually do something good and create jobs? And then at the same time, the government will get 50% back into the exchequer. You see, because of the tax. Don't forget, when the government is paying you, you're getting paid by them, but at the same time, the money goes back to them, right? Because you pay tax. And then when you buy services, they claim the VAT. Okay, so these are sort of economic things that we have to think about. We have to have conversations about this. So that's what social prescribing is. It's our link into primary care. It's to create new jobs, and it's also to offset, this mental health challenges that we have at the moment. There's a whole narrative on our website around social prescribing. You can download the social prescribing playbook, which gives you an A to Z on how to start. You don't need me to tell you to start, by the way. Please go do this work. Like, don't wait for Garrett or Professor Satpathy to tell you how to do this. Go and learn. That's the best way to do this.
Correct, exactly. In fact, one of the core tenets of social prescribing is community engagement. Without community engagement and dialogue, nothing is going to happen. Otherwise, if experts always take care of it and dictate the terms, then it's no longer social prescribing. It is medical prescribing.
Exactly.
Right? Okay.
And we have an overprescribing.
That is a menace that I do not want to even talk about, because I think we need to spend half an hour more to talk about
Spend
that.
a day on that.
Yes, maybe, yes. Because that itself is a huge problem in the UK. Means having witnessed that myself, yes. Maybe on another occasion, maybe during your summit, we would have some time to talk about that.
Definitely.
So, right. So let me go to the next question. So how can the principles and work of WHIS be more effectively integrated into the global health systems to address both healthcare and social determinants of health?
Okay, so this is going to happen quite quickly, as I mentioned. So, firstly, as I said on my presentation, the left-hand side is pretty saturated, okay, and it's in quite a dire straits. I spend about 2% of my time in that system because it's saturated, okay? And as I said, trying to change that narrative is very, very difficult, because unfortunately, there's no strategic leadership or vision. Whereas on the right-hand side is where the opportunity is. Now, the health system will be a laggard. It will come slightly later around. And it will take time. It's not going to happen overnight because you have a lot of vested interest in that area. But eventually, when you see the sort of returns and in terms of the opportunity and the way we keep people fit and well in this sector, all that will switch towards a preventive model of healthcare. Just today, I posted a blog this morning around the opportunity for hospitality. So what we're seeing now is people are investing heavily in their health and well-being because they recognize, well, I can't get to see my GP or I can't get my hip replaced. As I mentioned, 7 million people waiting here. People are saying, well, I don't want that to happen to me. I want to look after myself. So I'm going to invest in my holidays now, which are going to become where I look after myself, right? And this is where investment is going to flow into that new area. And there's going to be a lot of opportunity in this space. And that's sort of where I see this moving. The health system will move, but it'll come gradual, it'll come slower. As I said, it takes 17 years for innovation to be adopted in that health sector. And it's very, very risk averse. You have to understand it takes years. I mean, I'm doing this job for 25 years. I know my colleagues in the health sector, they're under enormous pressure because they have financial pressure on budgets, on different targets. They don't have time to be able to move into this space because they've no strategic headroom. Whereas me, I have that strategic headroom because I'm looking at opportunities. I'm looking at the next way that we can move things forward. So the health system is going to take time. Unfortunately, it will mean that we'll have rising litigation. So we're spending huge amounts of money on litigation. We're seeing the results, for example, in the UK. I mean, just pick up the paper every day, you have a scandal because of mistreatment, malpractice, and that'll happen all over the world, unfortunately. This is a huge, huge problem. Negligence is rising. And this is because we don't have enough staff. There's too much pressure. We have an aging population. The amount of pressure on the health system. But as I said, it will come when the population says enough of this. We can't have this keep going, and they'll push, whether it's the political parties or the politicians or the leaders of those countries, they will begin to understand that this will actually hit them in the pocket, because if people are unwell, it hits the pension funds, it hits the sovereign wealth funds. All it is all linked into financial mechanisms. So when it starts to pinch, as I said, 150 billion is a lot of money. And if you transition that across to global health, you're talking trillions of dollars, literally trillions. And that's what will move things forward.
And we are just talking about one country, then the entire globe, then it's a huge amount of. Let's do the maths later.
Yeah, exactly. It's too much. The reality is the numbers are so big that people find it difficult to understand. The reason, I mean, I'm grounded in this because I've grown up with health sector budgets for years. They're just numbers, and people don't, like, within the health sectors are so big. People don't realize how big the health sector is, but it is enormous. It's almost 10% of GDP worldwide. It's so big.
Yes. Unfortunately, some countries are not able to, like for example, in the case of India, not more than 2.2%. But in other countries, some countries are targeting 10%, literally. Yesterday I was reading, there's one country which was very critical of its national budget recently because they have not spent 10%, they have spent a little less than that. And that's why they are critical about it. In Africa, I'm talking about a country in Africa, literally. Yes, so I think the countries like ours, like in Southeast Asia, I think we need to learn from Africa and follow their footpath, and maybe we'll do better.
I genuinely believe Africa, Southeast, like Asia, you can drive your economy by keeping people fit and well, by introducing low-cost interventions. These are low-cost investments that I'm talking about. These don't cost a lot of money to invest in. And these programs will save you a fortune over the long term. I mean, enormous amount of money.
Okay, so I'm going to the next question. What are the challenges? You told a lot about social prescribing. Let's address now some challenges in scaling up the social prescribing, but not in Europe, but in lower middle income countries. Anything that you think that works better in the global north that can be tried in the global south, and we can learn from that?
Well, I think it's the mindset. Okay, so we've got a lot of legacy, right? So there's a lot of legacy here, which is very difficult to navigate. And you have the opportunity to basically learn very quickly, very rapidly, and adopt policies that will deliver preventative models of healthcare very quickly. And I'm talking within 5 to 10 years, you can have a new model of healthcare. We are not going to transition out of this for years because we're retrenched, we're stuck in a system that is not working. And we will continue to try and plug that hole for years until it gets to such a point that it's saturated, which we're nearly at. Like, I mean, you only have, if you look at the figures, I don't particularly think we have a health system at the moment because it's not working, it's not functional. You're basically throwing the dice. If you think we have a health system, I think we're missing all our targets for cancers and everything. So, but I do believe that you have an opportunity in Africa, in Asia, to adopt. And keep in mind, nearly half the population, over 3.5 billion people, don't have access to healthcare. They don't have anything. So when we talk about healthcare, only half the population have healthcare in some form. We still have an enormous opportunity to reach those underserved communities. And you talked about indigenous communities, and there's a lot of wisdom there. There's a lot of knowledge. We need to incorporate that. Don't necessarily, healthcare as well is based on a model which is based on white individual, a white male, me as per se, right? This is not the right way for treating people around the world. We need to change all that. That's an opportunity. This is a growth. This is a way, a business creation model that will generate jobs and opportunities. We need to have a holistic approach. Remember, we need a purpose in life. That's what drives us. We need that sort of like motivation to do good in the world. So these are all opportunities. If you ask me, Africa, Latin America, Asia, all these areas have so much opportunity to grow. But again, it'll be a mindset. You need the right mindset, and you need to also go get it, go do it. Learn, be self-motivated and go and take risks and don't be fearful.
Okay, associated with that, what you just told us, there is another question. Do you think the global north, where you are located, that is Europe and the Americas and Western countries, the global north needs to learn anything in particular from the global south? I'm confident that there are many, but I would like you to mention a few that you think deserve or merit our immediate attention at the moment.
Yeah, I do. I think we can learn. Everyone needs to learn. If anyone comes across to say that they know everything, then they know nothing. Because I know nothing. There's a lot to learn. I think from my experience, having been in Indonesia and others, what fascinated me was the collective group, and also what really encouraged me, because I was lecturing students in Indonesia, and what was really encouraging for me was that their empathy and their compassion towards their fellow human. That's what we need. We need more of that, But I'm also encouraged because, as I said, I have 2 little girls, and when I speak to them, they want to help homeless people and they want to become artists, So they're 9 and 12, so they're very much looking to the future. We have a lot to learn from each other, and we can, and they're just some of the ideas that I have from my perspective.
Right. So I go to the next question. I have a few more questions for you, Garrett. I hope you are not getting tired.
Yeah, perfect.
Okay. Can you share any success stories of the community transformation by WHS initiative in Europe and maybe beyond Europe, if that is possible?
Yep. Well, I mean, look, so there's a whole report. I shared some of it on the slides, and you can have the slides afterwards. I'll share them. But there's a whole report there. I mean, we particularly from the children. You know, there's some of the abstracts and some of the evidence was like, you know, the children were saying, you know, you've given me an understanding how to manage my own well-being. You know, just small little impacts like that. And then when we were having the events in Nottingham and all over the world, we always had very positive feedback. We had over 60% of professionals who had actually come to the event were saying, well, you were improving my knowledge base. I felt more comfortable. So we were always trying to transition knowledge, you know, so and measure our impact. So we've got a lot of impact. It's all measured. It's all there. And I can share those reports as well. And if you look at, we did do some prototyping in Thailand. We've had some engagements around the world in different parts. And they really, the feedback, it was embraced locally. When we just came back from Bologna, we had great feedback as well. So, I mean, these are just, the evidence is all on our website. You know, as I said, we had £1 invested, 750 back within our children's programs. That was pre-COVID, by the way. And then the overall aspect of, in terms of economic uplift, was £1 invested, 36 back. And that was an independent review.
Right. Right. So I go to the last 3 questions that is designed to be asked to you. So the 8th number question that I have for you is basically what you would do on a daily basis. So you should not have difficulty answering that. So what strategic recommendation would you offer? Sorry. So what strategic recommendation would you offer to governments and institutions looking to adopt this model of reformations in healthcare based on WHS? Because I think this has a lot of potential, but this platform that we are here today is all about strategic collaboration and communication. So I would like our participants to learn from you, because you have been dealing with strategic communication and collaboration for a very long time. So maybe you should share your experience, like what sort of recommendation would you offer to multiple government, not just European, maybe outside Europe.
Yeah, I mean, well, of course, I mean, look, so I think this really comes down to you. Firstly, when I'm working in any context, from whether it's Finland, I done a keynote in Finland, for example, on the future of healthcare last year, and you know the Scandinavians are considered to be always first movers and early adopters. So I presented this work to them last year in Helsinki, but it's very important to understand the local context. Okay, so you need, for example, I'm just giving Finland, but whether it's India or around the world, what is the pressure point? So, for example, in Finland, the pressure point is aging. They have an aging population, okay, which is crippling their economy. Okay, so you need to go with solutions, and you need to go with real, tangible opportunities for investment. So these are just some of the aspects. And if you're working in a government context, you need to understand the culture as well, and understand how you can work collectively, and what are the ideas coming from the other side. What is the pinch point? Make sure you read the reports, you know, make sure you summarize what the government's narrative is. Is it focused on, you know, hospital-centric care, or is it community focused? Understand which way the political spectrum is going on this, and then make sure that your narrative is appropriate to what they want. So it's very important to understand locally what's happening, nationally what's happening, and then globally what's happening. I'm quite fortunate. I work in a space where I'm able to give advice, but if you don't want to take it, then that's fine. That's absolutely fine. That's your prerogative. I'm only just suggesting that this does work here, and it can work in your jurisdiction.
Okay, great. This question is a little bit personal. So how is WIHS and GSPA looking forward to collaborate with the respected global entities such as the Global Health Forum, Global Consortium of Global Health LT, that are based in the Global South and are creating ripples in the broader space of global health while driving meaningful impact in the lives of many on a daily basis? So what are your plans?
So we want to engage with, you know, willing partners. Partnership is always, so collaboration and partnership are meaningless unless you have commitment. So it's very important to understand, because we get a lot of this all the time, and I get approached by so many agencies all the time to sign MOUs, and that's grand, but there has to be some sort of commitment. So what is the commitment? What is the objective? And we have to be very clear on what we're going to do. That's what I always ask. And what is the ambition? I think most importantly, when you're aligning your values, you have to have the same sort of vision in terms of, right, what are you trying to solve here? And personally speaking, as I said, I think that global North and South have a huge opportunity. We have enormous problems, North and South. So let's begin to leverage our collective, our collective our collective wisdom to actually navigate these systems. As I'm working at the moment on Commonwealth, on small island development states, how do we mobilize financial instruments to support small island development states, for example? That's a challenge in itself. And then the understanding from all stakeholders, what I think is so important here as well is you need patience in all this space. It's not something that's going to happen overnight. So, for example, I'm, coming close to my 50s. I've got maybe 20, 30 years left, and I see this as a 20, 30-year project. This is not something that's going to happen tomorrow. And if you're trying to raise capital, as I said, it's not going to happen in a month or in a two. So if you want to raise money and you're going to go out to the capital markets and you're going to start that engagement process with investors, it's going to take you 3, 4, 5 years to raise money, particularly on the scale we're talking about. So you've got to have that patience. So your partners have to be respectful of that and understand where you're both going. You're on that journey and how you can support each other to reach that goal.
Exactly. Means I think one of the things, whether it is individual collaboration or organizational collaboration, one thing that matters a lot is about commitment and respect for each other and being patient, simply as you just said, because many times we are extremely impatient about the growth. Like, people want to collaborate. This whole platform is all about research collaboration, right? And sometimes people are extremely impatient. They want to get a publication done in literally 1 week's time, which is not possible in a good journal, never, And if you want to have quality work done and make real impact in the lives of people in the world, I think we need to be very, very committed, need to be extremely humble and very patient, without which we are going nowhere. And in this regard, I see the WHS and Global Alt, the Global Consortium, have a lot of convergence points, and we are making good progress in terms of our collaboration. So I'm looking forward to that. I'm very hopeful about it as well.
One last point to make on this: the bigger the change, the longer it takes.
Yes.
So what you're trying to do here is change. As we've outlined here, it's a huge vision sort of transition. And I've been doing this for 10 years now, 25 in total, and it takes a long time. And you have to be prepared for setbacks, and you've got to be able to get up the next day and go again. You need partners that are patient and understand that, and that you're committed to this. And you don't need people to say, one day I'm with you and 2 weeks later I'm not, so you need, and that's why partnerships are so critical here. And that's what we need going forward. We need that patience.
And also a little bit of empathy, because many times we need to understand that if a thing is not making progress, let's say we agreed on certain milestones and it didn't reach its potential in a given amount of time, I think the partners and collaborators need to acknowledge that honestly and set new goals and milestones and just work around it, rather than giving it up or blaming each other or just being silent, because the silent treatment doesn't actually work in the case of institutional or individual collaboration at all. This is my personal experience.
Being transparent, being honest, telling people, as like I have to be honest, like, this work is difficult. It's not easy. It's not for everyone. You need a lot of persistence. You need a lot of energy. You need to commit to it. You need to sacrifice a lot, significant amount of your time. You need to understand that you're going to go through financial hardship. You're going to have to persevere through that for a long, long period of time. And nobody is going to come and help you. It's going to be, this is what it takes in order to make it work and to make it stick.
Yes.
That's perseverance. And you have to have an understanding from your partners that, wow, this takes a long time, a lot of commitment, and, understanding.
Yes. Means, as I just said, empathetic about each other's situation, the realities of the world, because we may be very wistful about many things, but that's not how the world works, right? So we have to be very pragmatic about how.
And family, don't forget people's family.
Yes.
People have a lot of things go on in people's families that people are not aware of, and you should always keep that in mind. I'm always conscious of that. If someone has to drop out of a session or they can't stay on, or you've got to be mindful that 9 times out of 10 people have a lot of things going on that you're not aware of, and can influence their decisions. That's why you've got to be understanding, kind, and but at the same time, don't be foolish. Do you know what I mean? Like don't like use your experience to navigate and don't go backwards. One of the things, never go back. Keep going forwards.
Yes, exactly. Because many times we start with a lot of vigor and enthusiasm, and then we give it up or we go back. I don't think that actually is a very progressive way to look at how things should be done. Rather, we should be making progress every day, even if it's very small, very minute. I think we should work around that. Okay. The last question comes to you. It's about the young people who are listening to us in this forum. So how can young public health professionals engage with the WHS or similar global movements like the Global Alt, which I am trying to encourage them to engage with and contribute so that the multi-stakeholder community engagement becomes a reality?
This is such an important question. Okay, so firstly, you need to be vocal in your support, and you need to show that support and stand up and say this is a good idea. Because remember, it takes a lot of courage to stand up and do this work, right? You decided, Professor Satpathy, that you were going to do this. I decided the same. But you need support from those, even a small little gesture, a message saying keep it going, and thanks very much. That means a lot. It actually encourages us to keep going forward. That's just a small thing you can do, right? Then always, I'm sure you have something similar on our website, for example, we're mobilizing. We have a volunteer community now that we've just mobilized. We've just taken in the first 40 volunteers from around the world. We have a form where people can allocate time to support our activities, to advocate for us on a local basis. So these are the sort of things that we're talking about in terms of building up that community. I even mentioned you may be part of a group, a community group that is doing an activity, a sports activity at the weekend or during the week, or you're doing some clinical study, whatever it is. And why not become part of the World Health Innovation Day? You know what I mean? So things like that. And then it's very important that we champion and support these good initiatives and good ideas. And understand, I think one of the biggest challenges that we have as a collective within the health sector is to understand how do we actually work together. And I mean, this goes back to the collaboration and the commitment side, because I genuinely don't feel we're good at that, because we're far too competitive. We are so competitive minded. From a perspective, we are really always championing on our own, so we're always pitching for the same money against each other, instead of collaborating effectively and saying, well, let's actually work together here, let's solve this problem. I mean, if you look at what we did when COVID hit, we were through drug discovery and a vaccine within 60 to 90 days. That's unheard of. That's unbelievable. Because we were we have to make this work. So we have the ability to do it, but we just don't do it that well. And I think in the future, whoever can crack that, not saying it'll be WIS or it'll be, the global health, it'll be whoever can crack that code of where we're able to work together collectively. That's where we will see enormous capabilities in human wisdom. As I said, the first slide that I showed, me and you and we and us going together as an armada. That's what we need. We need to be as an armada, a group of ships going in the same direction. If we can crack that, then, you know, the sky's the limit for global health.
Yes, yes, I think so. Yeah, many times, many of us are actually just interested in our own interest, individual interest, or our brand, our product, our own ego, Vanity Fair. And that is often the reason why many events, many startups even don't become successful. Yeah. And the reason because they just don't think about the community. They don't think about others, those who are partners, those who are holding hands. They just think about themselves. Me, all the time.
And we've created that society where we want instant success, instant payment, everything has to be instant, whereas anything I've ever been involved in that has had any real substance has taken years, absolute years to do. And it takes hard graft and it takes a lot of commitment. Normally, most business, in terms of meaningful business, is done without any monetary value, without any monetary payment. You're just doing it because you want to get something done, and you get a great as an individual, you feel fantastic when it's done. I mean, I've done lots of different things in the past where I've been raising money for charity or helping children's cancers, or and they're the things that make you go, wow, that's worth doing. And we need just more of that. We need to encourage that. And if you're listening to this as a youth, and the other thing is, find a mentor. Find people that will help you and look up to and share their time and give you that honest advice around navigating the future. Because if you can find that and learn, I mean, and be ethically minded as well. That's so important in this context in the world. We need to have more transparency, more openness. That's where the real opportunity lies.
Definitely, I agree with that, Gareth. In fact, there is a lot of work to do, and it can't be just for a particular period of time. It has to be a very continuous practice, a self-reflexive practice, because many times we just preach, but we do not follow that in our real lives also. And that is one of the challenges that I have noticed among many very, very successful in terms of materialistic value, very successful professionals. They just preach a lot of things in conference rooms, boardrooms, etc., but they do not actually follow that in real life, and then that causes a lot of trauma, a lot of baggage on other people who are basically looking for nothing but just some kind words of support.
Well, it's I think in the health sector, it's particularly evident because we can't retain the staff. Okay, so the biggest thing I always see, which is fascinating to me, is if you are having to recruit staff every month or every couple of weeks, you've got a real problem with culture. And then if you walk into that organization and they're talking about culture and they're talking about values and it's right in your face, but yet you're letting all these good people leave, there's serious problems there. We see this so evidently across the health sector, and it needs to own that. It needs to say we have a problem instead of masking it.
Yes.
You cannot fix that unless. The only way I've been involved in contaminated blood products, HIV and hepatitis C in the past, and the only way to solve those issues is to come out and be honest and transparent and say we made a mistake and we apologize, and how do we make it better so it doesn't happen again. It's the only way forward, and that's the learning. And if you can own it and you can admit, if I make a mistake, I'll say it. I'll say I'm sorry, I apologize. How can I make it better? And then I'll make sure I won't do it again. Or if I do it again, I'll own it again. You know what I mean? You've got to be willingness to change, and you've got to do this every day. You've got to practice what you preach.
Yes, correct. And just to say one thing, I want to end this panel with one thing. Like you said about NHS, on the basis of my observation, although NHS is held as one of the world's best public health systems, I would say in terms of staff retention, the third world countries, the so-called third world countries, the LMICs, are doing much better in retaining their healthcare staff compared to NHS or any other top healthcare system in the US or elsewhere. Because you just told about the dropouts and people leaving the jobs, etc., and the burnout and everything that they complain about on Twitter, Facebook, everywhere, literally also again. So I think that way the LMICs are doing much better. Yeah, this is something probably they can learn a little bit about how to manage people better, how to keep them motivated in a very
Not surprised.
in a low resource setting. Yeah. Yeah. Okay. Now we'll quickly go. Have some water because I'm going to read out a lot of questions. You have got a lot of very interesting questions coming from the audience. They're listening to you very carefully and they're asking very critical questions. In fact, Dr. Portia Manangajira is asking. She comes from Zimbabwe. She says a country that fared very badly since the MDGs, and looking at the proximity of the SDGs, how can we benefit from you, social prescribing and workforce development? How do we, as public health, convince government to consider and implement such practical interventions?
Well, very simply, go online to our website. I've given it, download the playbook. And it's from a cost perspective. Go from the economic perspective to your government because it's cheaper. You won't have to invest heavily in the infrastructure, as in the hospital sector, which costs a lot of money. And also from a training and development perspective, link workers, you can train them up within 12 to 24 months. If you want a consultant, you're talking 7 to 12 years. And the amount of money that has to go in investment into that side. So I would always look at from a government perspective, they're looking at job creation. So they want to create jobs, so you can create jobs. Remember, you have to look at the principles of government. They have to create jobs. They, as an entity, that's what they're meant to do. And security, defense. So hopefully that's helpful. And all there should be answers to your questions in terms of policy on our website. You'll be able to download that document, the social prescribing playbook, and you can actually bring it to your government. If you need more advice on that, I'm actually going to start a process quite soon of writing to governments to join our alliance, because we're going to onboard actual ministries of health very soon. We were going through we've had to change quite a lot within the social prescribing alliance. So that's sort of the next steps for me to do.
Yep. Okay. So there are two questions that is coming from one person named Ponti Wacharapon. She is saying, with your experience building the global platforms like the World Health Innovation Summit and the Global Social Prescribing Alliance, what do you believe are the key elements for successfully building and sustaining a community that drives real impact in health and well-being? And the second question she asks is, how can we create health innovations that are not only scalable but also truly rooted in the needs and voices of local communities? What have you seen work well in turning community insights into sustainable innovation? Very good questions.
Okay, so again, I think this is great. Health innovations don't have to be complex. They don't have to be digital either. They can just be simple. As I said to you, our WIS-Kids programs were literally me walking across and asking the head teacher, do you need a program for your children's mental health and well-being? That's how we created WIS-Kids. It doesn't take a lot of expertise to do that. It's sort of common sense. When you find out the need, look at the need is enormous. So innovations as well, I would give people a bit of a tip here as well. Don't necessarily focus on the hospital sector, because the hospital sector is saturated. The amount of pitches that go on towards hospital sector is enormous. If you look into the community, you're going to see a consumer-driven, shall we say, element over the next couple of years, where people are crying out for solutions and they want home treatment. So there's going to be a whole new wave of innovations which are going to move into the community. So that's a massive opportunity. Going back to sort of like talking about successful implementation from the Global Social Prescribing Alliance, and the first principle that I had with all of these, it's based on my experience having ran statutory agencies in the Irish government. You need some experience which will help you. And then the second thing is, of course, have a team and have people who encourage you. You need to bring that around you. it's always about people. Ultimately, the success of any project will come down to the people. But also, as a leader, if you're going to start something, you need to follow it through. And you also you'll find as you go through your journey, there's a lot of distractions, so many distractions, and I have fallen foul of that many a time because when I first started WIS and I had come to the prototype stage and we had delivered our impact of £1 invested 36 back, I then moved in towards the sustainable development goals and I went to the UN and unfortunately it sidetracked me from actually going straight to the capital. But I realize that now that you have to go to investors and you have to go to financial institutions and you have to show them that this works so that you can raise more money to do more good work. So these are sort of the strategies. Some of the simple things: have a terms of reference for your group if you're starting something from a strategic point of view. Ensure all your stakeholders buy into the vision, and ensure, as I said, as we've been speaking, all partners are into the vision and into the longevity of the project.
Yes. Okay. So now I move to some very, very critical questions. Okay. So
Yeah.
please tighten your belt. Arindam Biswas is asking, will SDGs ever be achieved in a sustainable manner? With the days, the gap between the haves and the have-nots, powerful and the vulnerable, are widening. That way, poverty may never be eradicated, and most of the SDGs may never be achieved. So, what's the role do they play, and are they utopic?
So the SDGs won't be achieved, not by 2030. No chance. Absolutely no chance. The reason for that is because we don't have any public engagement. So 99% of my friends have absolutely zero understanding of the SDGs. They've never even heard of them. And so we failed. And so there needs to be a realization that that's not, although myself and yourself are engaged in this space, the vast majority of people are not engaged in this space. And until we meet those people face to face, hence the platform, the WIS, the World Health Innovation Summit, going into the communities and addressing those issues locally and creating those new opportunities for jobs, for wealth creation, value creation, address those social needs. Unless we do that, the SDGs will become just a pipe dream. What will drive change quite quickly, though, you'll see it, is this enormous problems that we're facing. If you look at the Middle East, for example, 50%, I think, of those over the age of 50 have diabetes. Okay, so let's just take that for example. In the next 20 years, they're going to struggle to find and recruit and retain enough medical professionals to cover the amputations, the blindness, the social care issues. The cost of that is going to be enormous. So again, it'll come down to money, which will make people realize, well, we need to transition into a new model. So although I don't see the SDGs being complete by 2030, it won't be. We will transition quite quickly because of climate change and because of all the different evidence that's coming towards us. But we need a new way of engaging. We need a complete new way to engage communities. And although we're all switched on, there's not enough people switched. So and we're literally 1% of the population. We need to be hitting 99% of the population, and that's why sports clubs and musicians, they have a huge part to play in this.
Okay, right. Somebody is asking, Dr. Bashar is asking, how do you find the India's progress towards SDG goal number 3, that is health and well-being?
Well, so I mean, from the context of the SDGs in India and around the world, nobody's on target. I think the achievement of the SDGs at the moment is about 14%. I think it's pretty low. And I think this is pretty much a problem, as I said, in terms of engagement. And again, this comes down to political engagement, political will. We need so much more to be done in our local communities in terms of advocacy, education. starting at an early age. Like, you know, people need to be aware of the consequences of their decisions, of what they're doing. It's the same here. You know, it's such a problem. Like, we have, you know, so many problems in our local community, and similarly in India. I'm sure it's exactly the same. You know, there's just so many problems. In my opinion, we need a whole new way of engaging communities, and that involves media, and that involves using the tools, the digital tools that we have, but using them in a positive light rather than sort of the negative narrative that it's kind of spiraled out of control. It's a free for all. There's no real legislation that covers sort of like how all these systems are managed, who has access to knowledge and wisdom. There's a digital divide. There's so many people who don't have access to digital tools. So many people around the world who just don't have that basic knowledge or wisdom. So that's sort of where I think that's at.
Okay, there is a barrage of questions for you by Joshua Musa from Sierra Leone. He is asking, first of all, thank you very much for this great initiative and for your presentation. I have 3 quick questions for you, sir. What advice would you give the governments and the ministries of health preparing for the future of healthcare in resource-limited settings like Sierra Leone? Second, how can countries like Sierra Leone benefit from WHIS programs or partnerships? Third, in your experience, what are the biggest barriers to health innovation in developing countries, and how is WHS addressing them?
Okay, so my advice is, yep. First question, my advice is basically just to invest in prevention, and the long-term costs will be enormous, like in terms of cost savings, but also value created. Okay. The second question around WIS and how what we would like to do, as I said, over the next 5 years, we would like to set up in 100 cities around the world. Okay. So hopefully in Sierra Leone, Freetown, I think it is this Freetown? We will be able to set up and host an event and activity, and then spread and work with the government, and then also look at mobilizing private investment, private and public investment, into a blended capital financial structure to invest in these products and services, and sort of create those opportunities. In terms of, what was the third question? It was around innovation, wasn't it? So the innovation side of things as well. Be creative. Look at the problems that are in your community. What is the need of your local community, and then solve that problem and move that agenda forward. The other thing to say is, I mean, as I mentioned, if you're comparing health systems around the world at the moment, there's not a health system that I could say to you is doing well. There's not a health system who would be saying that's one to model on, because all of the health systems, it doesn't matter if it's Scandinavia, if it's America, if it's Middle East, if it's Australia, if it's in the Caribbean, all over the world, Latin America, all health systems at the moment are not standing up to the scrutiny and the pressure that they're under. So we need new ways of thinking and new models of healthcare which are based on prevention. We are very good at trauma, and that's one of the things, you know, we're specialist services and keeping people alive. We are excellent at that. We are, you know, if you look at the drug discovery, even the sort of like, even from haemophilia perspective, the way we treated haemophilia patients now, they can have the same quality of life as any normal person, which is just remarkable. So we have an incredible opportunity in life sciences as well. And these are all opportunities. Look in your local area. How can you support local life sciences to grow from an innovative idea that supports your local community, for example? So these are all opportunities to think about.
Yes, certainly. I agree with one of the points you just told about super specialty services being available, while the primary healthcare services being completely ignored and left to the disposal of just few professionals who are available to deliver the services, and hundreds of people, literally, in the case of India, hundreds of people standing there and just one doctor, or even a nurse many a times, no doctor, literally, just nurse, dealing with that. So it's actually very sorry state of affairs at many places, and it's not the case in urban cities, big hospitals, but in small towns, in rural areas, the situation is far from anywhere perfect. It's actually very, very dismal in nature.
But it's
So,
like
okay.
even oral health, you'll know yourself, oral health, if we are given advice at an early stage how to look after or your oral health is one of the most important aspects of healthcare. And a
People,
lot of people understand that. And these are simple interventions that can cost peanuts, like pennies, to offset at an early age, which will cost thousands going forward in the future. So these are the sort of things that we need to think about and understand long term.
after sustained advocacy, the Indian government is finally coming up with a national oral health strategy very soon, and they are trying to put in more money on implementation and operational research this year onward. So I'm very happy to report that, but at the same time, I completely agree that oral health is not even thought of as real health by the medical professionals themselves. Forget about the common people, because common people do not even have the money to go to a dentist and spend 10,000 rupees on doing a root canal, So basically that's the reality of the situation. Okay, let me read out 3 more questions before we close. Rosni Palthia is saying, thank you so much, sir. India is becoming a capital of diabetes. What do you suggest to control the diabetes and the policy development?
So, I mean, diabetes we know is mainly nutrition based and starts early years. So, I mean, really, we had developed these programs around WIS-Kids. Go onto our website. There's a short video. It's about 2 minutes. It just explains WIS-Kids, and you'll see some of the kids talk about how we gave them the information so they could make informed choices around diet and exercise. These are sort of things that we need to embed within our early years, so that we don't grow up with this problem. Long term, the diabetes situation in the UK is off the charts. Like I was just came from a session with the Scottish government about 2 weeks ago. The numbers are frightening. What people don't understand with diabetes is you end up with amputations and blindness, and this will cripple economies going forward. You're talking about literally, as I said, in the Middle East, 50% of the population have diabetes. This is an enormous problem, and it will cause massive contractions in your economy. So again, I'm kind of moving back to the economics of this, but if you put that early intervention in, you will solve these problems long term.
Okay. The last 2 questions for you, Garrett. Samira Muhammad. She says, what strategic approaches can be employed to ensure meaningful community inclusion in health systems strengthening, and why is this critical for achieving equitable and sustainable healthcare outcomes?
And so what strategies? So there's quite a lot of strategies that end up on the shelf. So around community engagement, you'll always find that there's, and what we tend to find as well within the health system as a whole, everything seems to go towards the acute hospital, which is where the money always is driven into, because that's where we send people. But we really need a strategic approach, which is towards the community. So as in engaging communities at scale. I've given an example. I've if you just look on the website, you can see the photograph that I showed of Nottingham. If we are really serious about healthcare, we need to do it at a level of scale. Okay, so I had this in Bologna. We had an event, and you were talking earlier. What's the difference between the World Health Assembly and we need to be in the community. We have got to mobilize thousands of people. And there is an opportunity. If you want a strategy, a simple strategy, as I said, engage with sports clubs. You want to engage with people who bring thousands. So, for example, India, go to the Indian Premier League, the cricket club, get involved with the cricketers, get them involved to advocate for health and well-being. I can guarantee you that the health and well-being of the Indian cricket team is priority, and they eat good food and they have good, and they realize that they don't have to eat burgers and chips or pizzas or, these are the sort of things that we need to people to understand. I mean, I was explaining this to a football club here, and you've got to look at this from a business perspective. Okay, so I talked to a football club here in England, a well-known football club, And I was explaining to them if they put public health messages across that their season ticket holders would live longer, which mean they would make more money. So it's a business proposition.
So which is your favorite? Which is your favorite club, by the
I'm
way?
a Man United
Manchester,
supporter. I'm a
Liverpool.
Man United supporter. So, yeah, I've
Okay.
had a
Okay.
bad season.
Okay. Okay. Right. The last question for you is from Emmanuel. He's saying, how can we bridge the gulf between the researchers and institutions of the Global South to be able to access the dwindling opportunities in research, funding, and technology?
Okay, so firstly, this again comes down to mindset. Okay, so if you're constantly being told that there's lack of resources, then you're going to believe there's a lack of resources. Okay, so you need to have an abundance mindset to think that I can go and access those opportunities, and don't take no for an answer, and keep moving it forward. And you will be at what I'm trying to do, what we are trying to do is to be patients, clinicians, managers, voluntary sector, education, and the business community, and to be able to mobilize that capital to be able to support those growth opportunities. I shared on my slides, we set up a not-for-profit, which is set up in the US to take in donations, to take in grants, so that we can work on these research opportunities. We would very much like to work with researchers, with academia. There is an enormous opportunity here in the global north and the global south to create new life science hubs. There's also opportunities to create innovation centers. You can create SMEs, you can spin them out. So we're open to that. We're kind of, that's our plan. We want to engage with governments, with institutions. But again, this is a partnership. This is how partnerships work. And you have to get to know each other. You have to understand what the need is, what's the need on the ground. But also take a lot from this. Hopefully this talk will give you some inspiration, will give you some ideas. And all the stuff I've talked about is published. It's all online. It's on our website. You can download it. You can ask me questions. So go and be inquisitive and find out more, understand, and then take action. But I do think, I know we're all there is restrictions. It is difficult. It's hard to navigate. It's not all easy, and it does take time. But you will find opportunities if you have a vision and you want to do something. You will attract those people who will help.
Okay, thank you, Garrett. So passionately engaging with all the questions, and obviously, in addition to my own rapid fire of the rounds of questions that you so graciously answered and so brilliantly answered as well. So, with this, the panel session comes to an end, but our work doesn't get over. Our work has just started. So, we have a very, very long way to go, and we have miles to walk before we sleep, as they say. So we start working, right now. So with this is my utmost honor again. Until unless you want to say something, and maybe after that I have a few announcements to make.
Yeah, no, it's just a pleasure. What I'll do is I'll share the presentation with you so you can share it to the participants.
Sure.
And, just really grateful for this opportunity to speak to everyone today. I hope it's been insightful. And I hope that we can work together in the future, and let's bring solutions to our community, and let's look forward. Let's not look backwards. Let's take the now, the present, and look to the future, what we can create, because the past is the past. All we got to look at is on the future.
Definitely. All that we have left is the future and present in the future, and that's what we should work on and we should be working around. And we are looking forward to that. So let me make a very basic and important announcements as the announcer, as the organizer of this program. Being the program director of Global Advanced Certification Program on Strategic Research Collaboration and Communication, this is my pleasure and honor to thank you once again, Mr. Gareth Press, to come on board and address us today, to the audience and illuminating us with so much of wisdom, so much of experience, and so much of brilliant perspectives, which I think we need that, and that complemented very well with the lifestyle medicine talk that Professor George Samuel Hanstad just offered. It was a brilliant talk as well, and that is the symbiotic relationship that we are actually working towards to create that holistic orientation, and so that our participants go back home thinking many things. Like they come here to learn few things, but they go back home asking many questions, and questions keep on revolving in their head. Right now, still people are asking questions, and some people were raising hands. Unfortunately, we are like very ahead of time, so we have to close. So my point is that we have been doing well. We did a great session today. Thank you for coming on board. And I must tell you a few basic important announcement. First thing is that in the tradition of our program, Gareth, I would like to inform you that our participants, those who complete the Global Advanced Certification Program, is a 3-month research intensive training program. It's the only of the kind state-of-the-art training program in the world, which trains people in active immersive skill sets on strategic research collaboration and communication. And that is deliverable to 870 plus participants who have registered for the Global Advanced Certification Program. And in addition to that, we have International Workshop Series participants. Altogether, on today, it is more than 1700 registrants. So that is a huge number of people that we are actually delivering, and it's completely for free. We are not being supported by anyone, not supported in funding, and we take immense pride in that, in saying that and acknowledging it. Why? Because we have been able to do it with the support of our fellow Samaritans who have been working as tutors, co-tutors, resource persons, team members. So I would like to put on record everyone's support and everyone's assistance, small or big, in every way that they have been doing for the past 1.5 months. Sleepless night, n number of sleepless night, 3 hours sleep night, sometimes no sleep at all, and still doing it, all purely because of the love of labor, just to help our younger emerging researchers to become the next generation future leaders, in the era of Global South, so that they take up the leadership of global health space. That is the only mission with which we are working, and we look for all your cooperation and support in this process. Gareth, you are my friend, dear friend, so I count on you. Second thing is that we are not in a position to actually offer you anything which is worthy of your stature. I would just like to express my thanks and gratitude, and as a token of appreciation, we'll be sending you, our admin team will be sending you a note of appreciation as a certificate of appreciation. And in addition, our admin team will be also be in touch with you regarding a request which you just told about, like the resource material, PPT, and in addition, your signature, which is going to be printed on the higher education achievement statement, which is to be given to all the eligible, successful participants of the training program. And so all the resource persons who are coming from all over the world, their signatures will be printed, so that it will be a legacy document on which they can claim that these top experts have come and they have taught us. And this is a big achievement for the emerging researchers based in lower middle income countries, and we are just trying to make it more incentivized for them. It's a big honor indeed, and we would love to have that. So please support us that way. And with this, the panel session comes to an end. I would request Faisal to do the last rites of the day. Yes, Faisal, over to you.
Thank you.
Please come on
Thank you,
camera so
Professor
that.
Satpathy.
Please come on camera. Faisal, don't be so shy. Okay, let Gareth see you also. Yes. Don't be shy. Come.
Come on. Raja,
Are you coming? Yeah, jaldi.
Yeah.
Quick. Okay.
good to see you.
Hello, sir. Thank you, sir, for delivering such an insightful and enlightening discussion that is based on the global collaborations. And thank you, Professor Satpathy, for moderating the program such a wonderful way that the participants engaged from beginning to the end. So the program has come to an end for today, and we will again sit for another panel discussions in the upcoming weeks. And we would love to have Mr. Gareth Perez supports in our whole the program through intellectual, through in other ways. So hopefully we will get the supports from you. And thank you all the participants for engaging throughout the session. And thank you all.
Okay, so I know Gareth will be here with us for a very very long time, as long as I am alive in this world. So that I can count on him. He's my dear friend, so he's not going anywhere. I'm not going anywhere. So with this, yes, absolutely right. So I'll be getting in touch with you, Gareth, over message, and thank you so much again. And if you'd like to say a word of inspiration to our young participants, those who are still listening after 3.5 hours, please tell them something.
Yeah. No. Look, it's a passion for me. You can see that. I mean, we're all similarly minded here. We have to stick together. We got to work together. We got a lot of work to do. There's a lot of people need our help. Just stick at it. You know what I mean? The health system has given me my career. I'm very grateful for that. I was fortunate. I started as someone who was packing vaccines. And the health system gave me a career, they gave me education, they sent me to college. So I'm very grateful for that. But we need to now look at ways that we can support the health system, and we need new models of healthcare. That's the reality. Focus on building the new, and don't worry too much about legacy. Just follow what's the future, what's coming. There is big opportunities coming, and go and grasp them. Like think about the enormous opportunity in Asia. You're going to have 4 billion people. 4 billion. Europe will only have 500 million. So, think of the size here. There's going to be a huge shift, and health systems will need to adopt. And you've got an opportunity to adopt to those new systems. We've had a great discussion today. This is a fantastic opportunity. I hope for the next 20, 30 years, we build this new system together, this new opportunity. We let it flourish and thrive, and then everyone wins. So that's all I have to say. It's a pleasure. I'm delighted to be part of the group and part of the team. We're all on the same team. Let's crack on with the work that needs to be done.
Yes, we have to build it together, Gareth, and we have to do it together. That's the only way forward. Okay.
Absolutely.
So have a great weekend, and I have taken away a lot of your valuable time, and I'm immensely grateful to you for this. So thank you, and I shall get an opportunity to meet you in person and virtually again later. Okay, take care.
Thanks,
Bye.
everyone. Pleasure. I've sent the PDF and the link so people can view the presentation.
Yes.
Thanks,
sure,
everyone.
Sure.
Bye-bye.
Okay, thank you. Bye. Okay, so participants, I hope you had a great time. So with this, the panel discussion and today's session number 7, gets to a completion. We had the great pleasure of hosting you all. So thank you so much for staying by for an entire duration of 3.5 hours, which is not a small amount of time. Okay, and let me tell you, it's not easy for us either, but we are trying to do it passionately just to be able to help you all. Okay, so thank you for all your cooperation, thank you for all your presence, thank you for who you are and what you do, and we are immensely grateful to all of you and for your presence. With this, the session comes to an end, but we'll continue here on this very link for something personal. We'll have a discussion. The common attendees may kindly fill your attendance form. The attendance form has been shared in the chat. Please fill it up. If you do not fill it up and send me personal messages, I am very sorry to say that I will